আচ্ছা তো PL to detect speaker বলতে
To introduce our first session talk, the first talk for the day by Dr. Mridul Mazumdar, sir. I would request Dr. Mridul Mazumdar and Professor Shimantu Sharkar to kindly come up on stage and take their seats. I would request Dr. H.S. Maji, Dean of Academics, to kindly come and felicitate our special guests.
Camera.
Thank you, sir. Now I would request Professor Shimantu Sharkar to kindly come and introduce our guest of today.
Hi, very good morning, everyone. It is my pleasure to introduce Dr. Mridul Majumdar. Dr. Mridul Majumdar is a pharmaceutical scientist with a PhD in pharmaceutics. He is also the founder and director of M2M Pharmaceutical Limited since 2016. In past, he worked for a CRO for 12 years in early stage of product development, especially related to material science for inhalated drug delivery system. He also worked in principle to CGMP as per the ICH Q8, Q9, Q10, and Q11. His special interest associated with amorphous materials, amorphous content determination with method development and the validation related to inhalation drug delivery system, solid form selection, batch-to-batch variability, amorphous solid dispersion, co-crystallization in solid state, and early stage of product development. So without further delay, I would like to invite Dr. Majumdar to take the stage.
Thank you. Thank you very much. I actually want to give a talk in Bengali. Anyone has got an objection? Do everybody follow Bengali, or do you want me to speak in English?
Better in English.
Better in English. Okay. I don't want to be rude to anybody. কারণ ওরা ইংরেজিতে তো সবসময় কথা বলি, তাই না? বাংলাতে কথা বলার একটা সুযোগ পেয়েছে, একটা রসগোল্লার জায়গায় এসেছি। No, I will be respectable to you. Good morning, Shuprabhat. Thank you very much for having me. I'm a bit emotional and moved because I have been asked to give a talk in front of my batchmate, in front of a junior and a teacher from Dhaka who I knew for decades. So I'm a bit moved, but I'm very happy and encouraged to see a lot of young people, those who are going to be pharmaceutical professionals over the decades to come, so that we can phase out, we can retire. You can pay on the pension fund so that we can retire on time, on peacefully. Hence, I am here. As the first speaker introduced me, I am Mridul Majumdar. I originally born and brought up in Bangladesh. Then I had a privilege and honor to study at Jisuconph University. Hence, been to the ICR, ICR. Then I went back to study, went back to work in Bangladesh. Then I went to UK to study further. I worked. I set up my own company. That's where I work now. I probably work 24/7, as you can imagine. So I'm going to tell you a bit of a story of that, bit of a story of new technology coming up, so that all of you can take some positive out from it, what you are going to face as you graduate from the university to go and develop your career, and also importance of academia and industry to collaborate. If we do not collaborate, we do not exist. How can we do that together? That would be main focus of my talk. This fancy site, you can see the images. This is where our office is. This is a picture taken when we moved from a very small space of our office to a bigger space. The local MK and a lot of pharmaceutical professionals in or around our office came together to celebrate a good day with us. I am also here to share a great news for a company I set up nearly 9 years ago. We have been just awarded King's Award for Enterprise. This is a very, very prestigious award. But I understand it is hard to make that into a quantifiable measure in front of you. What it does is it gives me an opportunity to talk to you, because it gives you a story to tell people that we were awarded. It also gives me an opportunity to go and meet the king at Windsor Castle and drink with him. And drink means, as you can imagine, posh drink one of the tastiest canapes you could ever imagine to have. I also had a privilege to meet his mom, Her Majesty the Queen, nearly 16 years back for my company to win it. So I have got a little bit of a relationship with the royal families. I don't know whether it is a good thing or a bad thing, but I thought to share some good news with you guys this morning. This is the postal address. All of you, it is an open invitation. If you are able to the UK, please drop me a line. Come and see us. We will be delighted to host you. We are just 40 miles from the Heathrow Airport. Please do come. And if any of you want to pursue higher study, please let me know. I am associated with various universities in the UK, especially UCL, where I collaborate immensely. Right. As I said, I will try to cover respiratory drug delivery system. It is very close to us, what we do. Since COVID, I am sure it is very close to all of us. And the dimension, the interest, the focus, the investment, the curiosity, it has increased enormously. Therefore, if you want to pursue and develop your career in respiratory drug delivery system, please let us know. Nowadays, they are called orally inhaled and nasal drug product. That means nasal has been incorporated into it since the COVID. And that's how now it is called YNDP, drug delivery system. The present market size, globally, it's a 46 billion, quite a lot of money. Don't just start putting numbers onto your iPhone to calculate how much it is in Indian rupees. But it is a big money, 46 billion, just for one drug delivery system. And we are expecting this to go up by significant amount to be 65 billion US dollar in next decade. Conventional PMDS, pressurized metered dose inhalers, which are often used in India, 1/3 of COPD and asthma patients are treated by this. I was just listening to, I don't know how many people you know in this field, John Pritchard from the UK. He was giving a talk at RDD Asia, where I was also a speaker beginning of this week. I just came back from Kochi actually. So he was giving a talk on changeover from the CFC to the present propellant to what the propellant we need to use in the decades to come, with the COP26 going on in the world. So presently we are using HFA 134A and HFA 227A, but they will be phased out. So another 20 years, you will see none of these propellants are any use. Especially companies like Cipla, Lupin, a lot of the Indian pharmaceuticals, they are all hugely investing and collaborating with a lot of other big innovators like GSK, like AstraZeneca, Honeywell, they all are in this field now, investing heavily. Heavily means hundreds of millions of pounds to phase out this because of the footprint, carbon footprint. If the present propellants are contributing to the global warming, we need to phase them out. Like it or dislike it, the sooner we do, better for us from every respect. I'm also delighted that I was presented a plan. That means we are slowly growing into the greener economy, greener country, and the greener global. And we all have to contribute. If we don't start from here, we will never reach where we need to reach. Three things work predominantly for the respiratory drug delivery system, but for any drug delivery system, that it is a combination of effort. It has to be between active pharmaceutical ingredient, whereby excipient like lactose, mannitol, trehalose, they all act as a carrier, and they all been put together into a device. All three things need to work in a very synchronizing manner for this to be effective. If one of them do not work properly, then it don't work. This is only for a respiratory drug delivery. But if you think about our life, everything needs to work in a synchronistic manner for it to work effectively. So it is a combination of everything which makes things better for us. Future trend, as I briefly mentioned, slowly, the present hydrocarbons will be phased out, and these are the two people are working with. We just need to come up with a better technology to implement HFA 152A because it is a flammable propellant. We need to be very, very clever because flammable means health and safety, and that's the biggest concern all the scientists working with the propellant phase out are facing at this stage. But once we work together, we will definitely reach one day. Dry powder inhaler, there is a lot of technological advancement going on dry powder inhaler for making a better powder so that it can go to the deep lung where we are intended to. Dry powder inhaler is also playing a significant role for a nasal delivery, which I'm going to show you some examples of it. For nasal, since COVID, nasal has become a hot cake as a site of action. Locally, systematically, and targeting the olfactory region or zone to reach the blood-brain barrier, so that we hope that one day we should be able to treat Parkinson's and diseases like Alzheimer's. So that's the target, and that's the place people are spending their time and effort and money to reach where we need to reach. This is just a schematic diagram of the nose. Presently, we are targeting locally here, and hence a lot of the nasal vaccine have been developed even since COVID. Over the time, we will also looking for a systematic delivery, but this is a big interest going to the blood-brain barrier, targeting towards that. And already scientists all over the world are making a right particle size with a right shape to go and target into those results. And that's quite exciting. And I want all of you to take a special note of this sort of technology coming into for you to play. Probably it's too late for us because we are getting older. Many of us have become already bald-headed. That means we will not absorb the science and technology as fast as you are. Therefore, it will be on your shoulder to take this forward and make the world better and serve for the humanity. These are the particles that excite us. As I said, one of the advantages of the nasal drug delivery is you don't need to reduce the particle size to less than 5 microns. You can play with the particles of around 20 to 25 microns, which means the more energy you put to reduce a particle size, the more challenges you face with respect to surface energy, with respect to static charge, with respect to handling of those particles, with respect to aggregation. These all things can be avoided if we can use little bit larger particle size for a nasal delivery. And that interests us as a group, that interests the global respiratory scientists all over the world. I don't know how many of you do Raman imaging. We do quite a lot Raman imaging, and from a gratitude purpose, all of you should be using Raman because C.V. Raman, he invented this, and we all should be doing Raman imaging. The reason why I am selling this to you is, remember in your professional life, images do not lie. If you say something, it is for real. And therefore, whenever you are doing a product development, always use Raman imaging as an analytical technique and try to be expert on this. And it is getting really popular all over the world. It's actually like nothing new. Say when you pass through airport, everything is scanned. Everything is scanned through an imaging technology. Nothing else. How can we make it into a pharmaceutical development, pharmaceutical formulation in each day? Not I have done it today. Oh, I will come back and do that 1 year later. The science and technology have changed. How can you do that every day's practice? You will see we will make a better drug, better product if we implement this. Some of the background, I will not go more in detail about this. This is how we work as a company, but I am not here to sell my company to you guys, so I won't go that much of it. Yes, but this is how you can do you've got amorphous content distillation. I don't know whether you heard about it. This is something, if you try to, say if you crystallize a compound, the particle size of that is quite, say around 90% of the particles will be probably 50 micron, 100 micron, 150 micron, but they are not respirable. For us to have a respirable particle size, which will go to the deep lung, or we call them as alveoli region, particle size needs to be less than 5 micron. So from 50 micron to a 5 micron means it's a lot of challenge. So when you make a lot of challenges of those, you do generate some unwanted, undesirable, unstable, morphologically different particles. We call them, often we call them amorphous material, and that interests us very much. If you don't deal with amorphous material, you don't have a good product. So therefore, this interests us quite a lot. Solid state dossier interests us. Identify crystalline material if you are developing an amorphous matrix, that interests us. And then overall developing in-hand product interests us as well. If any of you in your area ever interest into respiratory drug system, please reach out to me. I am heavily involved in LinkedIn, so you should see me. And if you don't see me on LinkedIn, I consider that you don't exist. Right. I thought I shall cover this. Himanshu told me, Mridulda, when you come, please put some slides for academia industry collaboration. When I go and talk, especially in London, where I studied and where I worked for a long period of time, one thing was constant in my UK life. Not even my wife, not even my child, because my daughter is 18 years old, and I have been only married for 19 years. For 2 decades, one constant relationship I had is with the UCL, University College London, and that relationship is just absolutely phenomenal. If I never studied at UCL, I would not have known what academia and industry collaboration means. And there are professors who just make a spin-out company with a novel idea, and that company becomes a multi-million pound company. And I'm sure India is doing it. If you are not, please talk to your teacher, get a novel idea, be brave, establish something. The world is changing, and when you wake up, we all breathe. We all have a blood circulation. All blood circulation are different, and everything runs in a dynamic pattern. We all need to be dynamic. If we are kinetically run, we will never improve and never develop. We all need to be dynamic. This industry academia collaboration is nothing but a being dynamic, seeing things in a bigger picture. As I said, I mentioned a lot of catchy word this morning, spray drying, particles, these are the, you can make money out of it. You can make career out of it. If you just believe in it and spend time, money, and effort into doing this. And I also urge a lot of teachers who are much in a different multitude of experience than me. Please be brave. Please take a lot of new technologies coming on board. Please collaborate, and of course, all these ideas needs to be incorporated from the money, because I will also highlight that, as because I run a company now, it is a very small company. I will also highlight that if you think that to set up a company you need money, you are in a wrong place. You don't need money. You need an attitude. You need an attitude to set up a company. Remember, money follows everything. It's not the money which follows, which dictates. It is the passion, it is the attitude which makes you different. And I urge all of you to have that on board and try to do something different. This is my journey. Already I was introduced, so I'm not going through all of those. But as you can see, this journey is a continuous process. It is a dynamic process. In those journeys, there are a lot of achievements. It may not be as heavy as many of you are here, but I thought to share that it is something one can do. So if I can do all those things, in a present generation, you can do much better of those, because you have a mobile phone on your hand. You have a Google Maps, you have Amazon, you have all those things. So you have got a much more responsibility to do much bigger things than our generation. So some of the pictures, as I said, images do not lie. So if you did not believe my slide, now you can now take that. I did met Her Majesty the Queen back in 2008. I also had an opportunity to meet then British Prime Minister David Cameron. Although please don't blame me that after meeting him that he lost the Brexit vote. This is the logo. Our company won this year, and we as a company can use this logo for next 5 years. So, this is quite a big thing for us. I'm going to spend a little bit of time to show you those are pictures, what these pictures mean to me personally, so that you can take a lot of positive out from it and put that into your life. So from left, I had a reception party with the King of United Kingdom, and then followed on the right hand side. So I was brave that I was very inspired. I'm not a big a political fan of it, but I was very inspired when I was very young to see Jyoti Basu walking with a dhuti Punjabi in Writers' Building. I may disagree with a lot of his political views and political things, but his attitude of walking with a dhuti Punjabi in Writers' Building always had that in my brain. And I thought, if I get an opportunity to wear dhuti Punjabi, probably not as good as him, but I will do that, and that's what I did. So. And the Scottish gentleman, he was a Lord Lieutenant of one of the county, and he grabbed me and said, "Oh, culturally, we both are the richest people in the world. Therefore, we should have a picture together." So he only asked the professional photographer to take that picture, and I thought to share that. Sorry. But the picture on this is very moving and very emotional. So this is the celebration we had, or the award presentation we had on 4th of November, just 15-20 days ago, at our place. From a decorum perspective, and it is a legal decorum perspective, I should be sitting left to the Lord Lieutenant who has come to present the award. So this is the Lord Lieutenant. I should be sitting always left to him, meaning he should be sitting always right to me. That cannot be changed. And then the mayor of a Rockingham Borough Council, which is left to me. But the important people for me in this photograph is Professor Graham Buckton. He was my PhD supervisor. He also gave me the job back in 2004, and I worked for his company for 12 years. Professor Adrian Williams, he is now retired. Professor Adrian Williams is the Dean of Research at the University of Reading. He was also my PhD supervisor. And then an industry collaborator, and then on the part that which did not come to the another PhD supervisor. So I did a part-time PhD with the industry sponsor. So I had a 3 PhD supervisor. Just imagine, I completed my PhD back in 2013. 11 years later, they all had a time to come and see us at our workplace, being present on that special day with a very, very busy calendar schedule. What have I done? I have absolutely done nothing. The only way they could do that, I had a positive attitude towards everything I did professionally for the last 2 decades. Hence, they spent the time to be part of us. How many of us do actually see our PhD supervisors in 10 years' time, in 15 years' time, 20 years' time? We hardly see that, because life has to move on. But I had my 3 PhD supervisors came on the same day with hundreds of people from industry to come and celebrate award ceremony with us. And I urge all of you to take a positive from this. And the other pictures are, and also the king, royal family, we often joke about them, but they do care, and they serve for the country, they serve for the nation. The 3 questions, the King of United Kingdom had a time to ask me 3 questions when I met him. He asked me, first question, in what category you won the award? So I told him that we won the award for international trade. His second question, which country you export your services? So I told him that I heavily work with mainland Europe, America, some India, some China, not much in Australia. His question was, are we doing better than what we had been before? Because he needs to look for money, right? They are all business-minded people. Are we doing better than what we had been? And a very, very interesting question here. How AI is helping drug development. do you think AI is going to play a significant role? So for a king to spend 1 minute to ask me these 4 or 5 questions tells you that they do care. Whereby there were nearly more than 250 recipients of them. So he needs to spend that time to ask people that question. It shows that people do care. Right. Academia and industry, we all have to work together if we want to succeed in life. Remember this golden triangle. Anyone heard about the golden triangle? Do you call this? So in Britain, a golden triangle is called London, Oxford, and Cambridge. If you draw it is like a triangle. That's why it is called a golden triangle for science, innovation, and technology. But in professional life, I call these 3 C's, they contribute to make a golden triangle. And I would again request all of you to think that and keep that on board. Colleague, whatever you do, nowadays you don't have a colleague, nowadays you have got friends and batchmates. But when you grow up, when you go to the professional world, they always be colleagues. They play a significant role in what you do. And always have a respect, always have a humility, always have an attitude, good attitudes towards them. Contacts and collaborators, they make you to go from A to B. So always keep good contacts and keep doing good collaboration. And of course, the client who plays the bill. So for all the professors here, all the teachers here, for them, client is government funding body. So they need to apply a 100 pages document to justify why their research is so important, so that the government pays them. So they are, in this case, government is client. And it is so true in every respect that there is always a client. When you go home, especially after a few drinks, when you have to make lame excuses when you go home, that's been wife is the client, right? So we need to tell her all the wrong things what we need to do. Important thing is what holds all these 3 together. Any guess? There's another special thing that holds all 3 of them together. It's called communication. So please be communicative. Please be effective communicative. That will make all the golden triangle to work in your favor at all times. If you look at the person sitting beside you, I'm sure you appreciate we all are heterogeneous. However, when we signed up to study pharmacy, we all have signed up intentionally or unintentionally to make a homogeneous product to treat we heterogeneous human beings.
Absolutely.
And I leave that with you. This is the scientific thought all of you, I wish all of you carry in your life. And thank you very much for having me this morning.
Let me take this opportunity to interact my classmate, Dr. Nidul Majumdar. So we are meeting after 24 years and we had no contact in between. So I'm very proud. Sir, please. In our Jadavpur University, there were 2 foreign quotas. One from Jordan. You know his name? You can remember? I don't know. I don't remember. He is, I also forgot. But we remember Mridul from Bangladesh. And after 2000, it's 2024, I am proud to welcome Dr. Majumdar in our university. And he is a very big man now, you understand. So it's a very nice and very much motivating. If one of the delegate is motivated by his speech, we'll feel proud to him or her. So what I understand that he's having a company producing the respiratory products After COVID, obviously, the demand is 100 times. So we know that it needs a propellant, and you know that propellant is giving health hazards because chlorofluorocarbon derivatives and the hydrocarbons, instead of having advantage, they are having more disadvantage. This global warming is also one of the related hazards. Other hazards are also there, and he is doing a noble work because he wants to take noble. What I understand, if I am not wrong, that problem they are focusing. The propellant is having very much problem because it delivers the drug in the lungs, and the particle size, what it mentioned, 5 micron or below 5 micron, that is controllable. That you can control. That also having some advantages than nanoparticles. Stability problem is less. Surface charges not getting any problem. But the delivery from the container to the lungs, alveoli, is very much high technology, high-end technology is required. So that propellant and that powder spray, that also a very big technology. We are not going to that. Mridul is working on that and supplying taking that world business is trading person. So I think I also now motivated whether at this age, whether we can think anything. It's the only idea what he told. And yesterday also when I talked to Hong sir, he is also telling, it's the idea. It's not the facility what we are having. It's the idea through which you can reach there where he is now today. So he's taking a very noble idea. Without we need a whole day to listen to him, and we don't have time to take a coffee also with him. Today he will be leaving immediately to Jadavpur University. He's having another talk. So without making it longer, so we are going to appreciate him with a token of love. Or okay, I'm handing over. Or if you have any question, you might have a number of questions. We already welcome you to the UK, and anybody can come and contact him for higher studies or anything. So we can interact later on through email also. Anybody can interact. So we will be appreciating his speech with the token of love.
I would like to call on stage Dr. H.S. Maji to kindly come up and felicitate and honor our guest speaker with a token of appreciation.
They are also in the stage.
Yes.
I don't want to miss this photograph. Please.
I probably have to leave that to my aunt house in Birati because I'm only traveling with hand luggage, and you don't want to know where I'm traveling to. So I have got probably another 5 more cities to do in India before I go back to Israel. And I'm only traveling with the hand luggage. My wife said, "How can you travel with the hand luggage?" I did commit to her that I'm going to do a washing now at aunt house which I haven't done. So I take that with the highest gratitude, but I will leave that with my aunt house. And next time when I come with a big luggage with the family, then I will take it with them. Okay. But thank you very much. Thank you. Thank you. I'm delighted. I'm honored. I'm humbled. Especially to see a lot of young people. I would like to see all of you become a fantastic pharmaceutical scientists and professionals and serve for the humanity. Your service is very, very important. We all need your service for our community. Thank you.
Thank you so much, sir. We will now move to our next speaker, Plenary 10 for the 3-day International Conference, JISU-PHARMA 2024. I would like to call on stage our next speaker, resource person, Professor Dr. Shitesh Chandra Bachar, Professor and Pro-Vice Chancellor, Academic, Department of Pharmacy, University of Dhaka. To session sir's chair, I would like to call on stage Professor Shomi Shamanto, Principal Dr. B.C. Roy College of Pharmacy and Allied Health Sciences, Durgapur. I would take this opportunity to introduce our session chair today. Professor Shomir Kumar Shamanto is the principal at Dr. B.C. Roy College of Pharmacy and Allied Health Sciences. He has been instrumental in the growth and development of the institution, which is recognized for its high-quality education and advanced research infrastructure. Under his leadership, the college has significantly enhanced its academic programs, including the introduction of various postgraduate and undergraduate courses in pharmaceutical sciences. Dr. Shamanto's vision emphasizes the creation of industry-ready graduates by fostering practical skills along with theoretical knowledge. His efforts to integrate advanced molecular techniques into the research curriculum position the institution as a leader in pharmaceutical education. Additionally, he has been involved in organizing national and international conferences, helping further the college's reputation as a center for pharmaceutical research. I would call Sir to kindly come up and introduce our speaker for today. I would request a speaker, Sir, to kindly come up on stage and take a seat. Professor Shamanto. Dr. H.S. Maji, Dean Academics of JISU University, is kindly requested to felicitate our guest before we start the session.
Very good morning to everyone. Respected dignitaries on the dais, honorable delegates. It is my pleasure to introduce Dr. Shitesh Bachar, speaker of this plenary session. Dr. Shitesh Chandra Bachar is serving as a professor in the Department of Pharmacy, University of Dhaka, Bangladesh. He joined in the Department of Pharmacy, Faculty of Pharmacy as a lecturer in 1997. He also served as Pro-Vice Chancellor and Dean of the Faculty of Pharmacy, University of Dhaka. Before joining the Department of Pharmacy, he received his D.Pharm and M.Pharm degree from University of Dhaka with good credentials. Professor Bachar was awarded a PhD in pharmacy from Jadavpur University, Kolkata in 1996. Dr. Bachar is a well-recognized medicinal chemist with particular expert in synthesizing Indian-based anti-inflammatory and analgesic plant growth regulatory compound and structure activity studies. He is an outstanding medicinal chemist with a pharmacy educational background. He also possesses unique expertise in isolation, purification, and pharmacological evaluation of Bangladeshi traditional and herbal medicinal and their quality. Professor Bachar has been successful in securing several research grants to support his research. He is an innovative researcher as well as an accomplished teacher in higher education sector. He has keen and objective driving of approach to whatever he does. As an academician and experienced in hospital and clinical pharmacy practice and management, Dr. Bachar has established clinical and hospital pharmacy practice in Bangladesh. He is also engaged in reduction of antimicrobial resistance in the community due to the inappropriate use of antibiotic as a member of National Technical Committee. Today he will be speaking on bioavailability study of erythropoietin in the healthy human volunteer. Hope this session will be very exciting and fruitful, and that this experience will be fruitful to your research. Thank you all.
Thank you very much. Available. Thank you so much. Thank you very much. I think this is yeah. This second. Yes, now thank you very much. Thank you very much for this. This topic was the clinical evaluation of the erythropoietin. But before that, it's better to say the total story how the purified erythropoietin is produced and how to conduct these clinical evaluations before we are using it for human volunteers. Because all of the world is all biosimilars. I think the students are very much aware about this matter. Biosimilar. I do have this down. Sometimes, insulin, isn't it? Insulin? Insulin? Students, insulin is the endogenous products. If you produce synthetically, artificially, similar to the protein or this insulin, it will be biosimilar. Similar to the biological components. That is biosimilar. The same things. Endogenous proteins, most of the biofunctional is not effectively or somehow is reduced in disease conditions. We should have to supplement from the outside as a drug. Then we go into the biosimilar proteins as a base. So it's okay now?
Yes.
Thank you very much. So that is the story how a biosimilar is produced with a qualitative manner and it is for market. But the important thing is each and every biosimilar is a new drug. That is why every country before marketing must have to conduct a PKPD study. That is clinical trial, because that is by equivalency studies with the comparator. So that's why I have this thing, manufacturing of biologics or biosimilars in Bangladesh. First time, the first molecule was synthesized in Bangladesh and it is in Bangladesh. That is there because I mostly participate in the biochemical evaluation, that is clinical trial evaluations of this research drug. That is my expertise. As Dr. Medun told about CROs, it's conducted in a CRO. So before going to my talk, I asked some little bit questions to my students. What is the largest tissue in the human body? Largest tissue. Anybody? This explains largest tissue. Largest number of tissues. Cell tissue. Good. And what is the largest organ in the body? Good. And which cell is the most abundant in the body? This mostly abundant. Okay. Without the cells, you cannot survive. So we can go for the answer. So muscle, skeletal muscle is the most largest tissue and largest organ is the skin, and most abundant cells in the body are this. So mostly our chat is concentrated on RBC, which is very much related to the erythropoiesis, because erythropoiesis, the process of the formation of RBC is originated with the erythropoietin. Erythropoietin accelerates the process of RBC formation. So you see some heavy oxygen to the cell. RBCs 1 to 100 days lifetime, 200 billion cells per hour. And you see another trace there, 1 billion oxygen molecules per cell is produced. And even it removes oxygen, carbon dioxide from the cells. Even 25 trillion cells of the RBCs in our body. And definitely another trait is there, 1 billion oxygen molecules. So 200 billion cells per hour produced. And this is very important. That's why it is the largest number of RBCs. But the contributions of the cells are very, very high. So, when we talk about erythropoietin is nucleotide hormones that boost erythropoiesis, the process of formation of RBC. And structure is three-dimensional like this. And this erythropoietin, you see, purified in the human erythropoietin in 1977. And in 1985, the cloning and expression of human erythropoietin genes was recorded. And finally, in 1990, the US Congress Office of Technology Assessment, the combinant erythropoietins was established. And now, lots of money, generations, drugs, etc. And that is the main things of our study, because Dr. Vidul told about the 3 trials relationships. Clients, collaborations, others, because I don't see others. But in our professional point of view, there is a triad relationship, In our professional, as a pharmacist, what is the triad relationship in clinical settings? Pharmacist, doctor, and nurses. These 3 things is very important for any healthcare setting. This relationship is very important, as well as for this relationship of these innovations or the establishment of the erythropoietin synthesis as a biomolecules. There are lots of money generation. And that's the pharmacist can establish a company. These simple things of this mechanism of actions or mode of actions of erythropoietins. You see, low blood oxygen is happening into some disease conditions or other things. The kidney and liver is activated to produce erythropoietin. Now you see, erythropoietin mostly produced in kidney. This larger size of arrow and less liver. And this, don't think about fibroblast. generally for endogenous erythropoiesis, when this oxygen level blood is reduced, kidney is activated to produce erythropoietin and liver, and this erythropoietin accelerates the formation of RBC in the bone marrow. And then through reticulocytes, the blood is produced and it's circulated. This is the simple mechanism of it. But somehow or other, if the kidney is failed, is unable to produce erythropoietin, the patient will develop anemia because of formation of RBC. And lots of problems because the number of kidney disease nowadays is increased day by day. And mostly the patients, those who have kidney failure, once in a week or twice in a week, they are receiving this. And when this kidney and the liver are in dysfunction for the formation of RBCs, then we are providing the erythropoietin from outside and then this process is increased and normal physiological condition is maintained, alleviating that disease condition. So, worldwide, first erythropoietin was introduced by Amgen in 1997 by Jisuconph, and then Iprex by Yanshan Clay, that is the Johnson company, Yanshan Clay, that was the innovator products, first it was then, and you see some biochemical assessments of erythropoietin products from Asia by versus erythropoietin alpha. Especially the erythropoietin alpha is the best thing because erythropoietin beta is there, but there is some problems because erythropoietin beta and alpha is the very effective erythropoietin for the production of RBC. You see, this is the standards of the Amgen erythropoietin USA, and this is Chinese products. You see, this quality is very good. This is very good, but there's so many active points are there, and simultaneously in Korea, this 3.5. This is also good quality, not so bad. This US one, and India, this is 5 manufacturer, and see the standards very. See this one. So that is the prevalence of the synthesis or marketing of the erythropoietin in this region, because most of the manufacturers are collecting the API from outside, especially China and other countries. India is doing also the results from the productions of erythropoietin API. In Bangladesh, this is this product I am talking about this matter, and this is the protein markets, and this is the competitor in Bangladesh, the leading market here in Bangladesh. You see this is the erythropoietin marker at kilodalton. This size should be this is the erythropoietin that what we're talking about. So 3 preparations, 3 bases are the same, but you see this fate also the proteins, the preparations is almost fate and the other aspect. So that is the competitor in Bangladesh, very much working in the management. When you see by SDS page and the devotion blood techniques, 2 methods, you see existence is very big, very down, but the quantity presence of the competitors erythropoietin. This is the scenario for the Bangladesh. That is why quality products to the patient, because the kidney patients, the sufferings of them, because as you, the introductions we have told about, they are also working in a safe drug management hospital settings. So the conditions I directly observe the situations. Oh, the patient is suffering for certain things. So this is the DNA with first biosimilar produced in Bangladesh for safety or for the patient's benefit, as well as for the doctor's confidence. When the doctor is confident that this product is quality and able to cure the disease to the patient, then definitely the doctor will recommend what products he or she has to prescribe. These are her conditions. So first of all, that biosimilar developed by DNA cell engineering. And it is very old stories, all everybody knows it, because you see, first the human DNA cell specifically, which is responsible for productions of erythropoiesis, was isolated. These isolations then is the DNA was just transfected to the Chinese hamster ovary cells. And from there, this stable clone with EP expressions was separated and clone is isolated, then qualifications and these API for the production is ready. You see, so Chinese hamster ovary cells are, most of the things cells are used for the medical research, biological medical research, and to produce protein-based medicines. So this is very academic talk, because when you study this biopharmaceutics or biological chemistry, then you will have to read these things. So when this APIs, we should have to prepare the market preparations, formulations. So the formulations, before that process of flow of the proteins, the computer controlled cell systems for us upstream process, that is a single house bioreactor is used. From that, the cell clarifier, then this is the respective reservoir for the upstream. From then, for the computer control purifications, for downstream system, the different column is used, and finally, this EPO API, yes, from the cell bank, the API is produced, and then it is for the final market process. So this is the single-use mixer, sterilizations, ready to fill products. From there, this different swings is introduced. Then finally, it is established by in vitro assay, and this is ready for the companies. So this is the preparations of the first biosimilar developed by DNA cells. So the process through which the qualitative way these biosimilar or this erythropoietin is produced was published in Pharmaceutics. This is the I am not the part of these things, but the main scientist is this Jisuconph and Nasmi. So both of them are American certified scientists, quality matters. And this important thing is here, when this approach is produced by quality by design with quality target product profiles, that is, you specify the parameters for the productions of the erythropoietin. Because when you place a tablet, you prepare a paracetamol tablet, you definitely would have to maintain the moisture percentage of the granules. I think fourth year students are aware about, third year, fourth year students are aware about these things. Particle size ratio have to be ascertained. When this ratio and temperature, even the drying temperature, what will be, should be determined. From the last 3-4 batches, you can assign these things if the quality product is opted. That is design of experiments, DOE, and quality by design. That is assured during the process. So in every batch, you will get the same quality product. So here, same thing. So the buffer volume and the pH of the solution is maintained specifically. You will get the top rated products. When the buffer and the pH is heavy, the redness will come down. So quality mentioned at the top of these things, that is the beauty for the formation of the erythropoietins by the scientists. This product variability is very, very less. And for information, around the world, those who are producing erythropoietins, the reputation is there for the raw materials, the raw products for the culture media is all take 700 milligram per liter. But in our company or our research work, the yield of the erythropoietin is 1500, is double, straight down, 1500 milligram per liter. And from this cell culture media, when it's purified, the world report is yield about 300, from 700 to 300 milligrams. And from our optical yield is from 300 to 100, about 70%. And that is also more than 50, less than 50%. And we have our yield is about more than 70%. That is this. This is the beauty of using this QD analysis and process or follow the QD process for ensuring the quality target product profile. So about this, because we synthesize the protein in the Chinese hamster cells by engineering, that have 164 protein amino acids. 164 amino acids, and the human amino acid chain is also 164, and that is 100% matched. That is the beauty. Most of the things, because you see the quality perspective, I saw this band is sometimes varied. Okay, because varied into isopar changed, not in the same scenario of 164 for this. There is other changes in the chain of these amino acids. That is this 100% match for what is called ensured by Q is exactly mass spectrometer. And this is available in the industry or in the lab. So sorry. Okay. So GP is also the receptor binding kinetics. To say this study bioreactor, this receptor binding kinetics is that our ligand and substrate. Ligand is this recombinant human equal receptor proteins, and ligand is this erythropoietins. Okay. So when a ligand is bound with the substrate, then response down. Okay, and then with this concentration dependent, so this response will be dependent on the concentration dependent. When you withdraw the receptor, then it will probably fall down. So, for example, you program a ring on the door. One push thing. You push on, but it is not locked. It is ringing and ringing. That should be in case of drug action. Isn't it? And if it is not locked, it will create a noise. It will create a noise, disturbing your mind, disturbing the environment. The same scenario is happened in the human body, when the drug is bind to the receptor, and after performing its activities, it's loosely bound and eliminate and dissolve to the cell side. It's cell side. And that should be. And if the ligand and substrate binding is irreversible, then so many unwanted effects happen in the body, producing toxicities. That is the main thing, because you see that dynamic bindings with K1 by K off ratio is 1, means there less toxicity of this happening. I shall show you later on through our clinical studies how sparing these products less toxicity compared to the original scan. So that is the important issue for dynamic bindings for K on, K off ratio. It must is 1. 1 press and 1. Because when the drug will bind to the receptor, the response will come. And this drug will not be reversibly bound. Reversibly bound. Because after getting response, the drug will release the site and will be disturbed from the body. That should be with less toxicity. But if it is not released from the binding site, so it will not come down. It will be like this. So that is the things to let you know how the toxicity is exhibited through the binding dynamics of the drug with the receptor and the electrolyte. So now it's coming to reports of the clinical studies as you are because the clinical evaluations of the adult human between the biosimilarities of the recombinant proteins reflects the standards. It was published in the first journals. This archives of clinical and biomedical research, and this is because for the clinical studies must have a doctor. That's why his name is there. It's me to conduct because mostly the research was conducted by. So with the research organizations, clinical research organizations, because we are planning these things. So this is the most randomized, double-blind, actively controlled because this blinding. I'm a pharmacist. I do these things. Which one will get these things? Which one is not? Because this doctor doesn't know what is this giving. So single dosing, crossover clinical trial, investing the pharmacokinetics and pharmacodynamic study, second files on this protein that is called erythropoietics standards with the threats after some healthy adult volunteers. So this is the parameters we use these things. So the demographic of the characteristics of this study group, we total around 21. 12 plus 12 is sufficient, but for gradually we have to extend that this number of patients we took because we recruited 83 volunteers. From there, we recruited 40. And their age, group, mean height, weight, BMI, historic blood pressure, baseline, endpoint, the actual blood pressure is the range is here. And the organic parameters after a single subcutaneous viscosity test and compared to after both crossover design, the Tmax, Cmax, AUC 0 to infinity, T half, CL by ratio, and the incidence time for the calculated from the studies to the model. And this is FREX, and we put it almost all are almost superimposed kinetics. And this is these parameters because the mean serum concentration time profile of erythropoiesis after single subcutaneous injections of the test and compared because this is reference reflex and this is the erythropoiesis. So we can see this kinetic parameters area of the car almost similar to the comparator. That should be. Otherwise, if it is any variations, which is not a standard. So for PD response, because we like to produce the number of RBCs and related matters, so that the response is okay or not, fine or not, that should be studied with the comparator. Because we see number of reticulocytes, see almost same as the reference and the proteins, and the mean changes of RBCs also increased in a phenomena as that of the standards reflects, and the mean change of hemoglobin also increased, and the mean change of these hemoglobin also same phenomena of the comparator. What is this thing? The response of the variable is almost similar to the standards. And as I told you before, about the toxicities exhibited in the patient's case, you see that is number of toxicities in various CNS, gastrointestinal tract, skins, totality is only 40, and the reference standard will be less than the next number of toxicities experienced by the 21 patients, so 22 patients in different types. So only 40 and this is 48, less than the standard. As I told you before, this is a dynamic bindings. This responsibly dynamic bindings of the drug that is precise. That is revealed. The total number of reported minor, not a major you can only minor events in clinical trial, no serious adverse events occurring. And that is also less than the better as well. And that is the beauty of this synthesis of this. So at the end, comparative values of this protein is clinically proven, safe, and effective in local population. Second, locally developed for satisfying global quality at affordable price, because the price is less. Most of the cases by the competitor, those who have taken the API from other countries, less than. Because colleagues, getting API using a licensing very cost effective. Even then, you will be able to produce less price. Single-use technology reduce change reliability cross-contamination. And that is the process we use, the cross-contaminations, because we are using cell engineering. That is the thing we get really cross-contamination to be zero. And BioPure, ready-to-use syringe, ensure quality products from manufacturing to use. There is this quality of the syringe is very important. We take it from America, and no animal origins materials ensures absence of biological contaminants from components. That is also important. And no risk associated with the products quality due to transportation changes from abroad. That is the main issues, because I show you that the competitors' proteins is a little bit different. That should be because of this, because transportations, the temperature and these other things is not maintained properly. That is the way the proteins that's created. And there is no chance of degradation because we are sensitive ourselves and treat the same process for the production of the vegetable. So this is all about my talk. So this is the quality biologics about the affordable price of the proteins, because we were able to satisfy the confidence of the doctor and definitely the patients and his family. And the good response we are getting from the patients, because it's very the patient, those who are taking the other competitors, After using these ubiquitin, they are showing this content. That is the beauty of the synthesis of very biosimilar electropoietics in Bangladesh. Thank you all for your patience. It's to be talk about this better. Especially my students should have to be how we can do this.
Thank you, sir, for your elaborative and interesting presentation. Now the session is open for question and answer. So it will the session will be more exciting if you put some question. So audience, please put some question.
Those who are interested to be a clinical pharmacist or industrial pharmacist, which one is their preference? Students. Students.
No question. So sir
I
has
think
explained all
so
this.
much
So
confident about
sir,
Yes, please, sir. Please, sir. Please, sir. Yes, please.
Yeah, a couple of companies are filing biosimilar.
Yes, yes.
US. And for other countries, I have inquired a couple of months ago. But the problem is, security of the data. So when I file in Brazil, there's a chance that the data will be stolen. So any view of this? The biosimilar is technology is very difficult, and you have to declare everything.
Technology is very difficult, is very easy as well. What means is the persons who are working on these things should have to confident enough on the activities. Because supportive machineries, because things that let you know, I'm not about this, talking about the Indian products. I have to show you that. This is it's not our one, which is published data about this quality of products. This is the published data. Some day before Journal of Pharmaceutical. We are not. This is not our one. They are saying this is the epogen of US. This quality products. Chinese. These are the Chinese. This quality products also. But there is some variations of yes. And this is also this polymer standard epogen USA. This is also very better. This is Indian, USA, this is USA. This one is good, but this one, these three things related to it. Different companies. So
My question is that
that's what I'm telling you. That is the things for data. The way we are using each and every data you will be able to right? For the things, not only these things, if anyone would like to contact with us, definitely we'll be able to provide the APIs and the technical solutions. So with the qualitative manner.
you are
And
taking API.
Yes.
That's great. That's great.
With API and thanks for the both.
Your product is comparable to others from
Yes, definitely. Definitely. See, you can compare it. That is.
So are you filing in US? Are you filing any biosimilar this?
Because we are filing in our country first.
Yeah, of course.
But we are now preparing for our friend Nepal. We are trying for that. We have a friend there. Try to this. We will talk about this matter. One of those friend there. We are trying after getting the regulatory process in our country. Then we should have to proceed on. So we have also contacted by equivalency. That report we can submit it there, and we are talking about it. But the company is due to after this corona and this situations of 5th August situations, most of the pharma company stranded. So we are thinking about it. But the way we are talking about things that is authentic, and we can assure you we will be able to provide the quality. Definitely. without any bias. Very, that's great.
That's great. But then again, CPA review is very tough.
Yes.
Continuous review.
These are every kinds of content data, what you want, the process, engineering, all kinds of parameters.
That's great. Thank you.
So I have a question, sir. The next slide, so where have you shown the completed? So you have shown that one competition.
Competitor,
Competition.
Bangladesh company.
Okay,
That's how
is that the interpreting isoform or what is that? That
Yes.
one?
This report is another form.
So if it is like that, so in the Western blot, it should be same.
This, yeah.
But there is no staining of if it is isoform, so as a protein chemist, what I know, that must be same. I have worked with the protein, so if it is isoform, that should be same with the Western blot.
Because after derivations, the actual report is not. But this quantity is not able to read it out.
Actually, there was it is contradictory as there is that stain is very prominent. So if it is like that, quantitatively if you calculate it, that is as good as your product. So if it is isoform, that should be stained with the Western blot, but there is no stain. That's my question.
So that is the thing. I think this is the data. Maybe.
Okay. Another question, sir, you have worked with the bioavailability. Erythropoietin is a protein. So, how have you detected in the blood or plasma that erythropoietin? What is the detection system, sir?
It's a mass. Extractive mass spectrometry.
Okay. So, from the genetic engineering, when have you put the clone gene? There is a chance of expression of hundreds of protein.
Yes,
Where from there, how have you isolated or identified that very erythropoietin which is useful for the human?
this one.
Yes, this is your plan. Very nice.
Very specific.
Yes.
Specific.
But after cloning, what actually in
That is the
engineering-
purification.
Yes.
Purification. That's why actually this
Okay.
immunity analysis.
Okay, sir. Thank you for your interesting and very timely presentation. This session, Dr. Bachar has elaborately explained how the erythropoietin helps in the production of the blood cells and increase the oxygen level. He also explained the development of and purification of GB protein, and he nicely explained the nice bioavailability study, including the pharmacokinetics and toxicity study. Hope this deliberation will help the budding researcher, and this experience will inspire them in proteomic research and as well as pharmacokinetic research. So thank you again, sir, and thank you all the audience for your patience and cooperation. Thanks.
Thank you, sir. I would request our very own Professor John Chatterjee, sir, Professor of the Department of Pharmaceutical Technology, JISU University, to kindly come up and do the honors of giving the token of appreciation to our speaker and our session chair. Thank you, sir. For our next plenary session, plenary 11, we have a resource person, Professor Dr. Milind Parle from Guru Jambishwar University of Science and Technology, Haryana. I would request sir to kindly come up on stage and take his place. For session chair, I would like to call on stage Professor Kavalakanta sir of the Department of Pharmaceutical Technology to kindly come up and introduce our speaker. Before that, I would request Professor Jayanta Chaudhary to kindly come up and felicitate our speaker. So, Professor Jayanta Chaudhary felicitating our speaker for today, Professor Milind Parle. Thank you, sir.
Morning, everybody. I'm Professor of Department of Pharmacy. The beneficiary is Dr. Milind Parle. Dr. Milind Parle is the President of PhD, ex-Dean, Faculty of Medical Sciences, FID, rated Chief Editor, Annals of Pharmaceutical Sciences, ex-Chairman, Department of Pharmaceutical Science, Guru Jambishwar University of Science and Technology. Innovation distinguishes between a leader and a follower. In order to be innovative, one should have a big vision and take small steps to daily basis on get there. One should be very humble and honest when one begins one's time experiment, but not at the same time. One should be imaginary, visionary, unique in recording one's observations. Learning and innovation go hand in hand. We cannot take excellent engineers, doctors, pharmacists, lawyers until we are able to create good human beings. It is not about the sudden accomplishment of a grand invention, but it is all about a little innovation every day, every week, every month. At present, there is no perfect animal model for measuring learning ability of experimental animals. An ideal animal model of memory should have a reasonable to the human memory. This new instrument design in the present invention looks like a chess board and is named as cognition board. This novel model is based on the principle that animals and memory on repeated exposure cognition board. It is capable of testing working long term as well as spatial memory. This is instrument exhibited excellent face, constructive, predictive validity. Dr. Milind Parle, the author, who has been conferred with several prestigious awards such as Best Teacher Award, Eminent Educationist Award, Pharma Ratan, etc., shall be sharing his experiences and innovative ideas with the delegates of the conference. So, I request Dr. Milind Parle, now the dais is yours. Please come, sir, and share his experience with us.
Right. So, thank you very much for the nice introduction. The students who are standing back, please come and have seats. I love all the students, my students, students of JIS, and all Indian students. I have prepared this talk specially for you, for students who want to become successful professionals. So those who want to become successful professionals, please be attentive. And for young faculty members, middle-aged, and the senior ones also, this talk would be helpful to each one of you. That's a guarantee. I'm fortunate that I'm the last speaker, so we can have very good interaction. So it's an interactive session, and I'll be glad. This is the second conference JIS is holding. You should have good vision. You have your dean, Dr. Himanshu Majid, with you. I was a resource person in the first conference also. It was held in 2020. And that time, Majid said that the moment Corona era is over and we hold next conference, I'll be inviting you to our campus. So thank you very much, the organizing committee and all those involved with the organization of this conference, volunteers and the faculty members. So here I am with you to share my experience, my research findings with you all. You have been having heavy technical talks. This will be a special technical talk in which you will feel there is nothing technical. It's popular. You'll enjoy my talk. Whether you are from pharmacognosy, pharmaceutics, pharmaceutical analysis, quality assurance, pharmacology, analysis, chemistry, whichever field you are, of life sciences, you will surely enjoy my talk. And one guarantee, you will be carrying nice message when you go home from the talk I deliver, provided you listen to it wholeheartedly. I'm not going to say like other speakers that at least 2 or 3 students should carry the message. I want each one of you, everyone without exception, to carry useful message for being successful in your professional and life. So if you are with me, we move ahead. Are you with me?
Yes, sir.
Thank you. We'll be talking now integration of innovation research, and education. Right. See, now, how should be our training? Okay. We are all in a university for learning. Our training should be such that graduates have a versatile personality together with moral values. See, Calcutta is known for great personalities. We have Ramkrishna Paramahansa, Rabindranath Tagore, etc. Unfortunately, recently, bad incident took place in Calcutta in a medical college. We are all aware. We cannot have excellent engineers, doctors, pharmacists, lawyers until we are able to create good human beings. So it's very important that the teachers sitting here, the parents sitting here, and the seniors here are successful in creating good human beings. Now, what is education? What is education? How many of you know of it? It is just not blackboard and chalk. This is a Latin word educare, which means to teach, to coach. Even if a coach is coaching a pelwan or a shooter or a cricketer on a field, he is a teacher. Explain, instruct, inform, train, enlighten, nurture, prepare, refine, supervise. We have PG students, we have PG guides, and we have PhD guides. Preach. You must have been in ashram last evening. Elevate, uplift, transform, and inspire. The location for education could be, it could be a home, it could be a school, and it could be a university. Now, what is the purpose of education? We have defeated the purpose of education. All our energies are lost in what? Framing the syllabus and implementing the syllabus, covering the syllabus, and cramming what is taught in the syllabus. That's not what education is all about. Those who are in the field know, whether in industry, hospital, or in teaching, that we hardly apply what we had been taught in our classroom. The purpose is to develop physical, mental, intellectual, and spiritual faculties. That is the purpose of education. So let us ask ourselves, the faculty sitting here, the administration sitting here, are we doing justice to the purpose of developing physical, mental, intellectual, and spiritual faculties? What is the education today? Look at theoretical knowledge and practical skills. Students are bombarded. A microbiologist talks so much of microbiology. A biochemist talks so much of biochemistry. Is so much of technical knowledge of biochemistry or microbiology really required for everyone sitting here? It's practical skills. What is the hands-on training you have? What is the special skill you have developed? Why a surgeon is respected? Because he has a special skill. Very delicately, he can remove the abnormal part and make you normal. Unless we have such skills, teachers should have a sense of belonging. I'm happy, the day I landed in Calcutta, I was received well by the volunteers, and the teachers were in constant touch with me. And yes, I could experience the sense of belonging. JIS University, this is my university, should be the feeling. I am here, whatever I am, it's for this university. And then it is both ways. The sense of belonging comes by the commitment, wholehearted, round the clock by the teachers, and adequate incentives, remuneration, privileges, perks offered by the employees. Every individual is different. has a unique set of talents. See, sometimes teachers like front bench students, I love last bench students. Those who are sitting at the last, they are my favorite. Because if I'm able to give my message to them, I've done a good job. Yeah, if I have taught a brilliant student, I have not done anything. Perhaps he is gifted and he is studying on his own. And one thing I'd like to tell all the teachers, the students who are on the back benches, students who are less privileged, students who are not very intelligent, they are the best resource persons. They are most successful in the field. You know why? Because they know they lack something. They don't have a gold medal. They don't have distinction. And this they have to compensate with hard work. I've been getting very good students. I'm a scientist. You all can become a scientist. I'm going to tell you a story how towards the end, you will all, if you want, can become a scientist. It's very easy. The best scientists are children. So many ideas they have. So let us keep in mind, every individual is different. There is nobody who is useless on this planet. They have wonderful, great, unique talents. Only thing we have to nurture those talents. We have to build that confidence. Nobody should feel that I'm inferior. And this is the job of a teacher. This is what the education is all about for. Development of strong teacher-student bonding. This is very important. And this doesn't come by firing, scolding the students or punishing the student. It comes with love. Students will respect you if you fire them, scold at them, if you are harsh to them, as long as they are in your university, as long as some internal marks under your control. The moment they pass out, they will not respect you. I tell you, my students today have holding best of the positions in the world. They have become professors, chairpersons, deans, vice chancellors, examination controllers, scientists, but they respect me. They respect me the most, and I experience it on day-to-day basis. Just before coming to the stage, I have sent a message to a group of my students. I am about to deliver my talk. I'm about to move on the stage, and I receive all the best from them. This feeling, after 25 years after my teaching, the teachers have come towards retirement, still respect the teacher. This kind of bonding comes with love. It comes with knowledge. It comes when you have really given something to the student. When I give an assignment to the student, you know what the feeling I have? It is not his assignment, it's my assignment. I have to see to it that how he completes it. I should know his personality, I should know his strengths, I should know his weaknesses. If I don't know, I am not a teacher. I am burdening. I want credit that I have 1 publication, 5 publications. I have guided 10 students for not guiding. That should not be the scenario. I think you are getting my point. Student assignment is my assignment. I should lose my sleep. I should work around the clock. Each student whom I am guiding. And then I should be able to tell, why will not this student who stands on his own legs with your guidance remember your whole life? He will say, sir, whatever I am today is only because of you. And this kind of bonding teachers have to develop. It's a great pleasure, It's a great pleasure. Asli sampatti yahi hai. Asli estate yahi hai. Your students are your ambassadors. Now, what are the challenges? There are a lot of challenges. There is lack of will to learn among youth. They don't want to learn. New generation, it's easy to blame. You are on Facebook, you are on WhatsApp, you are on Instagram, and there is lack of will to learn. It's a challenge. But then we are fortunate, we are in this era where we can use positively this technology. I'll be telling you how. Quality of teaching. Students will come to your class only if you are useful to them. Otherwise, a lot of material is available on Google. A lot of books are available as soft copies. And if you are not able to do your job, you just have to inspire students. You have to make them work and you have to show them the right path. They will be with you. I'm happy the hall is full today, and students are very encouraging and enthusiastic to know the details of the town, government reservation policy. These are the limitations, challenges we have to face. Infrastructure in the university. Not all universities have excellent infrastructure. You are blessed, comparatively, I've seen many universities in the world. And JIS has good infrastructure. Research culture. Unfortunately, this is decline. Very sad state of affairs. How many patents are filed? How many inventions have come from our country? It's all because we are lacking the research culture. There is no adequate rewards to the scientists who are spending time in research. Your workload of teaching is asked, but nobody asks you what is your contribution to research. Your publications are seen, and those publications maybe these days are published in some purchase journals, which have absolutely no value. Now you take one disease. We have to take one disease to become a scientist. I take Alzheimer's disease, for example. Very simple. Alzheimer's disease is where hum bhul jate hain. There is loss of memory. Now, why it is Alzheimer's disease? Because it was discovered by Alois Alzheimer. One German patient, one German physician had a German patient, a lady, 51 years old, by name August Ritter. She had memory loss. So this doctor observed one day, the lady has guests sitting in the hall in her house. And she says, well, would you like to have tea or coffee? The guest said, no, we'll not have anything. Okay, I'll give you some fruits. And she goes inside. She forgets what for she has come inside. She looks at tea, coffee, milk, she comes back. She remembers as she has to serve fruits. Again, she goes. She opens the fridge. Forgets again that she has to take out the fruits. This is memory loss. From going one room to another room, she has forgotten the purpose for which, and this happens to many of the elderly patients. One doctor said, this is not aging. This is a special disease. Nobody recognized him. He, like a conference in an international platform, he presented this finding. He said, I have a patient who has terrible memory loss that she cannot carry out executive functions. Everybody said, no, it is due to aging. And the chairperson was his senior earlier working in the same college. Now for promotions, he had gone to another college and he rejected. There is a lot of cutthroat competition and jealousy. This man will become a great doctor if I approve. So they rejected the concept. Young doctor, 28 years old, pursued his research. He followed up this patient. After 5 years, this lady died. Being a family physician, he did postmortem studies, studied the brain of this lady and found out, yes, there are amyloid plaques in the brain. There are some special deposits, neurofibrillary triangles in the brain. Then he studied 10 more patients of same age group from say 41 years to 55 years. She was 51 years. So in same 10-15 years of age group, he studied more than 15-20 patients. Did post-mortem studies, studied their brain. There were no amyloid plaques. Only in one brain they were there. It means this is a special disease. The age of all the patients was same. And then later on, after 100 years, 125 years from now, this was a story of 1901. Today is 2024. We all know what Alzheimer's disease is. And after his death, after Dr. Alzheimer's death, whole world talks of Alzheimer's disease. And this is the fate of every scientist. Sometimes that you face obstacles for coming into limelight. But these are the challenges. You have to pursue, you should never give up. These are the causes of Alzheimer's disease. Why one has, dementia, amnesia. There are two terms, amnesia and dementia. Students, are they same? Are the two terms same? Amnesia, there is memory loss. Dementia, there is memory loss. If these two terms are same, why the two terms in the first place? So, if you are able to hear me, can anybody tell me what amnesia is? I will tell you. Yes, good, very good. You said something? Anyone? Yes, you are very right. Please sit down. See, we have active students, and this is what I like about students. Amnesia is a temporary memory loss, which can be restored. You have cannabis, you have a bottle of alcohol, liquor. You might have forgotten many things. आप गम भूल जाते हो. अमिताभ की शराबी picture भी है. Then you come back next day and you are normal. There is no memory loss. You remember everything. This is amnesia. But dementia is different. Dementia is a organic damage in the brain. There is a neuronal dysfunction. It's a permanent damage. It's not restored next day or third day. You need treatment. And even the treatment is not effective. That is dementia. Where there is organic damage, it is dementia. Where there is no organic damage, that is amnesia. Okay, these are some of the causes. Age, yes, as we age, and if we don't take care, we are likely to be weak in our memory. Improper diet matters. What kind of vitamins, proteins, junk food, what are you taking daily? That affects your brain. Sedentary lifestyle. If you lead a sedentary lifestyle, you are not active physically, mind and body goes hand in hand. You will not be active mentally also. Low education, yes, if you don't keep yourself up to date, just as we do exercise, we do walking, go to gym for body. What is that we do for our brain? There is no regeneration of brain. There is continuous decline. So what is that we are doing? In Japan, Sudoku is popular. I play chess. I'm an international chess player. That is one reason I could not make it earlier. I'm just coming by participating in an international tournament. It's not that I was a player. I am a player today. Today I'm an international player. After 4 days, on 25th of this month, November, entire world is going to talk of India. You know why? One Indian of 18 years old, Gukesh of Tamil Nadu, is going to become world champion. He has challenged a Chinese player. Present world champion is Ling Diren. The tournament will take place in Singapore. But this man, Gukesh, is so strong. 25th, the match starts. I'm going to watch each moves. And many chess players, Calcutta has chess players. So what I'm trying to say is, I play chess to keep myself mentally active. That had been my passion. And can we integrate chess with pharmacology, chess with pharmacy? We'll see. Can animals play chess? Can my mice will play chess? That is the question. You all will say no. I'll say yes. Yes. Some of you as human beings have brain developed, would be playing. Some of you might have. We'll come to that. So these are some of the causes. Now, what are the clinical signs of dementia? I think my talks become interesting. When rats can play chess, why not you all? Why can't you develop your mental faculties? Dementia of recent events. Difficulty in performing familiar tasks. You are not able to perform your familiar tasks. Aphasia, agnosia, apraxia, dyslexia, agraphia. These are some of the symptoms. Briefly, I'll explain this because I want to focus more time on the scientist part, the chess part, and how to become, a successful professional. Aphasia is loss of expression. You might have seen some individuals coming on the stage fumbling for words. They want to say something, but they are not able to express. This is aphasia. Agnosia, inability to recognize objects. We are not able to recognize the familiar objects. Apraxia. Apraxia is loss of motor skills. You are not able to drive. You are not able to play table tennis. Tremors are there. Dyslexia. Dyslexia is loss of reading ability. Agraphia is writing ability. Dyslexia, some of you must have seen Amir Khan's movie, very popular. Yes, very nicely. Dyslexia, the child is, gifted, is differently abled. Dyslexia is very nicely displayed. What is memory? Quickly and tell. We have different types of memory. It is an ability to remember. It's a complex function of the brain. I don't find memory in our syllabus, That is the most important thing. A child needs good memory to score high marks. A youngster requires good memory to perform his executive functions, to clear IAS examination. And elderly people to prevent memory loss need good memory, to retain the position. So memory is most important. This is the first thing which should be there in physiology, pharmacology, pathology, whatever we are studying. It's a complex function of the brain. It's a capacity to retain the information and later on retrieve the information. There are memory champions, competitions are held. It's far from being perfect, but it's very impressive. And it is crucial for one's career and executive functions. If you have good memory, you can score good marks. Now, what are the different types of memory? We are using it, sensory memory. For example, in this hall, I see several things. I see your dean, I see your administration, I see students, I see volunteers, and I see mementos and flowers and laptop and whatnot. This all goes into sensory memory. It has unlimited capacity, but it lasts for a fraction of a second. The moment I look at the screen, I have forgotten all that I have seen. It has a large capacity, it is short-lived, majority of information fades away. But if we give attentional weight to it, it goes into short-term memory. If we are attentive, it goes and it's remembered. Then we have short-term memory. It is a workbench of consciousness. It has a limited capacity, 7 items. It's temporary storage, only for 30 seconds. Maintenance rehearsal prolongs it. I'll just give you an example. Nowadays, I like to keep myself up to date. The new generation, you work for, digital banking and activities and your shopping. You get an OTP. You go to message, you see the OTP and you have to enter the OTP. You come back, while you are entering, you forgot. You go back to messages again, 4, 5, 6, 3, doorbell rings, again you have forgotten. You go back. So this is short-term memory. It is in short-term memory. And then once you enter it, you have forgotten. This is what short-term memory is all about. It can be easily interrupted. It's like a leaking bucket. Now this short-term memory can get converted into intermediate long-term memory. If you rehearse it, if you maintain it, if you practice it, you'll remember it. Sometimes I find PG and UG students, in pharmacy we have huge syllabus. We have a semester system. And it's overnight which students learn. And they don't form a concept. They just cram the things. They are awake whole night. Then आखिरी रात पढ़ लेंगे. Exam का एक बार timetable लग गया फिर पढ़ाई शुरू करेंगे. This is a common practice. So it's neither in sensory memory, not in short-term memory, intermediate long-term. The moment the book is with them, the moment it is open, they remember everything. Next day when they go to examination hall, they are blank. They don't remember anything. Because the concepts are not formed. It's not in long-term memory. Forget of examination. You need to practice this knowledge when you go into the field. You need it 10 years after. I am presenting something. If I have learned 40 years ago, and if it is not in long-term memory, I also would be like a dumb man who doesn't remember anything. This is long-term memory. Long-term memory is a hallmark of an expert. It is a result of structural synaptic changes. You need to concentrate, you need to connect it with some associated information, and you need to make an effort to get it into long-term memory. We have amygdala, hippocampus, and cerebral cortex. These are the brain parts which store the information. It's a lasting storehouse for meaningful material. It retains vast amount of material. You know, there is no limitation. Your mobile may have a limitation of 64 GB, 128 GB. Laptop may have some 512 GB or TV, but still limit is there. Human brain is supreme. Supreme. Gukesh, who is a world chess challenger, in one of his interviews, he says, I remember 5 billion positions of chessboards. And that's the reason he is that world challenger. 5 billion positions, chess positions. It's possible. I remember some 50,000 of them. And if I work more, I can also remember more. It's a matter of effort. How much effort you can do. These are the nootropic agents in market. They help you to enhance your memory. And they are all symptomatic, you know. We don't have cure today for Alzheimer's disease. We don't have cure. Alzheimer's disease is a day-to-day problem. Almost every elderly individual. And nowadays, younger individuals also suffer from dementia. Now, why we don't have a proper disease treatment? Why don't we have a medicine? Why don't we have a cure? Cure? Anybody can tell me? Why don't we have a medicine? When we have medicine for diabetes, we have some medicine for hypertension. We could discover a vaccine for corona pandemic, which is deadly virus. We don't have medicine for Alzheimer's. One reason I see is animal memory is poor. We don't have an animal model. We cannot test every new substance which could be poisonous in humans. Now, unless we have a good experimental model, how are we going to discover new agents? We need to test it in animals, preclinical studies in the first place. So this is a challenge. There are several challenges in health sciences. No, I'm just opening. We have these marketed preparations, donepezil, rivastigmine, galantamine, all of them act through increasing the levels of acetylcholine. Acetylcholine is a neurotransmitter which is crucial for retaining the memory function. We have some anti-glutamate agents also, memantine, amantadine, ribosole, and many XYZ compounds are under clinical trials. These are the laboratory. What laboratory models we have? We have indirect laboratory models. I'll tell you how we test new memory enhancers. Scopolamine induced amnesia. Scopolamine is an anticholinergic agent. It's a muscarinic antagonist. It blocks muscarinic receptors. It does not allow acetylcholine to act, and you have dementia. Diazepam-induced dementia. Diazepam is a sedative, a sleeping pill. You take it for long, and you have amnesia. Alprazolam-induced amnesia, aging-induced amnesia, and ethanol, alcohol-induced amnesia. Alcohol is one thing. You know why we say young people or anybody should not take, because it's affecting your brain. It will produce amnesia. It will produce damage. And these are the animal models you have. Are these good models? Now let us come to the discovery. How to be a scientist. How to be successful in life. Discovery is spotting something for the first time. If you are able to spot something, when I enter the campus, I see a new bird. New bird in JIS campus. Now the bird is there. was on this planet, it was in the campus, but I have spotted it for the first time. So that's discovery. But if I create something new, which never existed, if I design something new, then it is invention. So, whether discovery or invention, you all should be innovative. You need to be innovative. You should be able to think out of the box. Then only it's possible. And innovative nature distinguishes between a leader and a follower. You have to be innovative. One innovative thing I observed, I tell you, as a delegate in this international conference. I don't know how many experts and resource persons and delegates and students have observed. You'll be surprised. When I tell you, you'll agree. Should I tell you what is the innovative thing I observed this time? I congratulate your organizing committee chairman and my friend. Dr. Himanshu is my close friend. And I remember everything because we had met many years ago and we are in touch. I've been attending conferences, presenting talks all over the world. We have excellent cultural programs, a special cultural evening, gala, dinner, and all that. But this is the first conference where scientific programs are blended with cultural functions. We have 2 academic talks and 2 cultural items. Wonderful thing. It's a wonderful thing. I become fresh. And that's what is essential. This is innovation. This is thinking out of the box. What a cultural in charge would say, no. For a dance program, I need a special stage. So you have your scientific program at stretch and then give me a stage to control for the cultural program. We cannot change it. But it's possible. It's possible. Some delegates who are brainstormed with technical talks over the day may not have stamina to see your wonderful preparations of the cultural program. You must have seen me, I have taken the video of some of the cultural programs going on earlier in the auditorium. You know, this is what I'm going to show it to my colleagues, my friends, and organizing committee members. I'm a president of an international organization. I'll be hosting a conference in Mysore. I'll be sending the brochure to you all. This is on 30th January in Mysore. Mysore is another tourist place, wonderful. So we try to hold every year and conduct wonderful things. So this is thinking out of the box. You have to face challenges. I understand how much opposition you must have faced. Doesn't it look foolish to blend dance item with a scientific talk? But every foolish idea becomes a great idea. It becomes a great idea. So it's like that. It's just like that. You have to be stupid, you have to be passionate, you have to be foolish, and then you are appreciated. What is innovation? It is just thinking out of the box and implementing the idea. The process of translating an idea into a device or a service that is beneficial to the society. Innovation is a net consequence of inspiration to perspiration. You know, it has no shortcuts. You should have inspiration and you should perspire around the clock. I've seen all of you working around the clock. I appreciate the volunteers. We had a different seminar hall yesterday. We have a different seminar hall today. And everything is set in no time. On time, we are running all the programs. Salute to you all. Kudos to the organizing committee. Well done. Well done. All. See, there are 10,000 substances. You synthesize as a chemist 10,000 substances, out of which, when you do biological activity, only 250 are biologically active. Out of 250, when you do animal toxicity studies, only 25 are safe. It began with 10,000, now 25 are safe. You move to clinical trials, only 5 are able to clear the clinical trials. And then when it comes to medicine, phase 3, phase 4, we have just one approved medicine. And then $1 billion it takes, so much of expenditure involved. And then a question will come from the backbencher students here. Sir, $1 million, so much of synthesis, 10 years of time. How can we become scientists? We can. Yet we can. In the existing facilities, in the given infrastructure, without a single dollar, you can become a scientist. How is the story now? Work is worship. In this land of West Bengal, Calcutta, I did not talk of Ma Sharda, Ma Saraswati. You know, work is worship. Goddess of Gyan, knowledge, wisdom. If you love your work, you will enjoy each day. You know, now I am superannuated, but I am not retired because I am working. I enjoy my work. And while I was working, actually I did not work for a single day. It was just a fun for me. I was enjoying my work. When you play a game, you like it. It is not a work for you, it's enjoyment. And that's how I enjoyed my life. And even after retirement, I am enjoying my life. I am sharing with you my findings. Be passionate. Whatever you do in life, just be passionate about it. It is not how we live. It's not how we live, let me tell you. How much we love and live for others, that matters. How much we live for others, that matters. True love is unconditional. It's just unconditional. Young boys, girls, you may have boyfriend, girlfriend. If you love somebody, remember, you love somebody? Good. It's not a business. If your partner does not respond or wish you happy birthday, don't stop loving. Don't put a condition that because I had wished you and you did not wish me, I stopped loving. This is not love. ये कोई प्रेम नहीं है. Had you put this condition before looking at the girl and loving her, that if you don't wish me, I'll stop loving? You had not put this condition. Then true love is unconditional. एक तरफा ही सही प्रेम तो करो. एक तरफा करने में क्या अर्थ है? एक मूवी हमने देखी थी हिंदी. I'm fond of movies. I'm fond of many things. Ranveer Kapoor asks Shah Rukh Khan in that movie, क्या आसान है मोहब्बत करना जब जवाब में मोहब्बत ही ना मिले? क्या आसान है मोहब्बत करना जब जवाब में मोहब्बत ना मिले? You know what Shah Rukh Khan says? एक तरफा मोहब्बत. It's wonderful. It's the most beautiful thing in the world. ना किसी की इजहार की जरूरत, ना इकरार की जरूरत. ना किसी के इजहार की जरूरत, ना किसी के इकरार की जरूरत. हम तो प्रेम करते ही रहेंगे. और उस प्रेम में हमें बदलाव आएगा. इतना ज्यादा बदलाव आएगा कि impress her. It'll change my personality. I'll become an outstanding person. मर्दाना पुरुषार्थ करेंगे. And this is what you will gain. So it's the most wonderful thing in the world. It's more, and you don't lose anything. ना कोई निराशा, ना कोई धोखा, ना कोई betrayal. सिर्फ प्रेम, प्रेम, प्रेम ही प्रेम. क्योंकि एक तरफा है. हमें ना इकरार चाहिए, ना इनकार चाहिए, ना इनकार चाहिए. हम उसके ऊपर हैं. It's like, now, what is the criteria for filing a patent? To become a scientist, you have to file a patent. There was a question asked, did you file a patent for your findings? It should be non-obvious. Non-obvious means anybody should not be able to discover what you have. It should be non-obvious. Innovative step. It should have one innovative step, one new step, and commercial application. It should have commercial application. The only way to survive in this world is by continuously transforming yourself into a new entity. You have to transform yourself into a new entity, and that's how you will survive in this world. If I talk of my generation and how we read the books and sat in the library, I'll be outdated and thrown out. Young generation doesn't want to be. I have to transform myself. I have to accept the young generation as it is. I have to accept them as they are, and I have to work with them and be with them. Nobody is interested to know your story in life, you know. और यही प्रॉब्लम होता है सास बहू का. हमारे जमाने में कुएं से पानी लाते थे, चूल्हे पे खाना बनाते थे. भाई वो जमाना अलग था. हम थोड़ी ऐसे करेंगे. बहू कहती है आप भी चले जाओ, या तो गैस सिलेंडर चलेगा या माइक्रोवेव नहीं चलेगा. You have to live. You know? There was a time when students, doctoral students, were awarded PhDs without publications. I insisted in my university for the first time that we should have residential coursework to check whether student is ready for PhD or not, whether he has the necessary background training skills. So we introduced this compulsory stay and UGC implemented it. Initially, we insisted that there should be 2 research publications in good journals before a PhD award. There was a strike in my university, everybody against me because they want a PhD degree without publication. But then it became necessary in the UGC that you should have 2 publications. Then I told my students, it's not enough. Now there are many journals, you know, you pay money and you get published. You should have a patent. Each of my PhD students has a patent. They know if you are enrolling with Milind Parle, you should work. And if you have a patent, you get a PhD, otherwise not. My first student, when I insisted this, when she got enrolled with me, she said, sir, नया breakthrough, नई discovery, उससे तो नहीं होगा. मैंने कहा बेटा क्यों चिंता कर रहे हो? ये तुम्ही से होगा. You will do it. My experience, my wisdom, my standing in the field. I want your energy, that's all. Your enthusiasm, willingness. Okay, sir, I'm with you. I'm going to get enrolled. And she gets enrolled with me for her PhD. She comes to me and says, sir, let us devise some model for Alzheimer's disease. मैंने कहा बताओ. Sir, आप chess खेलते हो? You're a good player. Chess जो खेलते हैं उनकी memory अच्छी होती है. Chess improves memory. So you now make your animals play chess and improve their memory. This is my model. And she goes home. Her job is done. I lose my peace of mind. I am a guide. She has given the idea. If you want a model for memory, it is chess. Yes, I am a guide. Now, idea is hers. I should do about it. How should I do about it? Think out of the box. Okay, I tell her. Have you seen a chessboard? Yes, sir. Bring the chessboard to the department. She brings the chessboard to the department. What does a chessboard has? It has white squares, black squares. White squares, black squares. Alternate black and white squares. And this is our model. You know, I said we'll call it memory is a cognitive function. So we will not call it anymore as chessboard. We'll call it a cognition board. Now, as a guide, it's my duty. I should do all that. I lose my peace of mind. Midnight also, when I get up, I think how to have a memory model. Student is ready to work. Sir, आप मुझे काम दो, मैं 24 घंटे करूँगी. Holy Diwali छोड़ के, I'll be in the lab. You assign me the work, you assign me the project, and I'll work. तो हमने देना है, project तो हमने design करना है, objective तो हमने design करना है. So, if I am not clear to myself, I cannot. But yes, I was clear. I am clear. Today, I'll explain you one model. Next time, guaranteed, with this audience or the new batch of students, Dr. Himanshu sitting here, representative team sitting here calls me, I'll present another discovery with another student, find a new patent. You just give me less than 2 years, 18 months of time, and we'll have a discovery. We'll become a scientist. How? Cognition board is like a chessboard. I'll tell you how I did it. Now, when I can do it, you can do it. She's an ordinary girl, not a brilliant girl, not a gold medalist, not very, but hardworking. Hardworking Punjabi लड़की जो hostel में रहती थी, आज वो mother हो चुकी है. She is the director of an institution. She is very well. Cognition board will have sensor board and drop board. She tells me one day, अब कैसे पता चलेगा animals कहाँ से कहाँ जा रहे हैं? So let us fix sensors. So we fix the sensors to the board. So we have now two boards, sensor board and drop board. Animals form memory on repeated exposure to the cognition board. Animals learn fast. Mild setback, dropping into the cloth bag. And for a patent, we need a unique endpoint. अब एक दिन क्या हुआ सबके साथ होता है ये जो लड़की है एनिमल हाउस आते आते गर्ल्स हॉस्टल से which is less than 300 meters comes very late. हमने 9:30 बजे बुलाया होता है और वो 11:30 बजे तक आती है गायब हो जाती. But one thing I appreciate about my students, this I tell them every day, कि आपने सच बोलना है जिंदगी में. कुछ भी हो जाए आपके साथ, बोलना सच है. और सच बोलेंगे तो you will have integrity, reliability, and you will grow in life. चाहे गलत काम भी किया हो, आपने बोलना सच है. So that day she comes late. You are thinking of filing a patent, you are thinking of becoming a scientist, and I wanted she to have a fast PhD degree, a doctoral student. Yesterday evening, last 4 days, I've been telling her, come on time, and she's coming every day. One day, instead of 9:30, she reaches running at 11:30 to the animal house where we have psychopharmacology laboratory. I asked her, बेटा, वही देखो, क्या आप लेट हो गए हो? हाँ सर, सॉरी, पैर चुने लग गए. मैं बताती हूँ क्या हुआ मेरे साथ. बताइए क्या हुआ? My mind is thinking on how to develop a model for Alzheimer's disease, how to make rats play chess, mice play chess. और ये लड़की वक्त पे आई नहीं है. I wanted to discuss something with her, and she's telling me her story. You know what she says? सर आपको पता ही है कल शाम को बहुत बारिश हुई थी और यूनिवर्सिटी में एक जगह इतना बड़ा गड्ढा था. मैं उस पे अच्छे से तैयार होकर अच्छा ड्रेस पहन के आ रही थी. मेरा पैर उस गड्ढे में गया और क्या बताएं, fully wet and lower part of my dress was in bad shape. I had to go back, take a bath, and then I could reach here. So I'm very sorry for that. What a teacher would do on hearing this. Any faculty member, what a teacher would say to her. Punish her, reward her, she has been truthful. I patted her on the back. Better, well done. You have a model discovered now. What are we going to do? The animal will fall into the ditch. Oh, आपका animal गड्ढे में गिर जाएगा. That's a mild setback. We have a chessboard. All black squares are hollow. They are not solid. वो जब भी black square पे जाएंगे वो नीचे गिर जाएंगे सीधे. And we have attached, you can see on the drop board right hand side, there is a cloth bag. So that the animal doesn't face an injury, we attach the cloth bag. That injury now. So now we have a chessboard. Both the boards, we know one is a sensor board and other is a drop board. But for animals, they look alike. Rats can identify black color and white color. Not all the colors of rainbow, but dark color and light color they can identify. And with the arrows, you can see non-hollow black squares, then white squares, and on the drop board there is hollow black square and non-hollow black square. This is the difference between sensor board and drop board. Simple idea I tell you. What we want to record is, we want to record how many times the animal drops into the drop. And we want to record with the sensors, the count. That's a simple story. Now there is a setback, to the animals. No animal or none of us likes to fall into a ditch. So no animal wants to fall. So it's a mild setback to the animal. And this mild setback, the animal remembers. Next time when you put the same animal on a same looking board, it will move on the white squares only. It will not move on the black squares. Now I am getting a unique endpoint. As a scientist, I know that patent, it should have a unique endpoint. It should have an innovative idea. So when animal goes on the hollow square, you can see at the top, mouse drops through the hollow black square into the cloth. It drops into the cloth. And this setback, it remembers. Now our end point. Next time what the animal does, it is standing on the central square, with its mouth, it pokes. Is it safe to go here or not? It's very intelligent, you know. It checks. You see, it's standing on hind legs. It's touching the back square lightly with the paw because it doesn't want to fall. It's developing a memory. We are developing a memory model. It's developing a memory. We are going to test memory enhancers. We are going to test memory blockers. As the animal discovers white diagonal, it can move 3 degrees. In chess, bishop moves diagonally. Here the animal moves diagonally because white squares are not allowed. On both the board, they are solid. They cannot fall. And then we record the counts. I think you have got the idea. A small idea can give you a great invention. The end point is safeguard behavior, decrease in number of drops through drop board, and decrease in number of counts on the sensor board, which is the learning index. Now, what are the advantages of this model? It's a very simple. Did we require $100 for this? No. Simple and cost-effective model. No noxious stimuli, no torture, because electric shock and burning tail, nothing involved. It's a peculiar and unique endpoint, can file a patent. Currently marketed medicines can be detected. Next thing what we did, you take the memory enhancers, nootropic agents, paracetamolic agents, donepezol, test on this model. They worked. We got terrible results. We got better results than any other earlier model because it is directly correlating with human memory. New memory enhancers can be identified. It has excellent face validity, construct validity, and predictive validity. These are pharmacological terms. I'll just tell in one sentence. Those of you are interested, can contact me. You need good face validity. Face validity means those symptoms which were seen in Alzheimer's patients should be present in your animal model. Construct validity means your model should have same construction. As we have gradually memory formed by repeated exposure, by repeated consolidation, similar way we should have. And predictive validity, we should be able to predict new medicines. We are able to predict the new medicines, your model is effective. We go for patent, a simple device for testing memory, a simple device for testing memory, and for testing, detecting anti-Alzheimer potential of new medicines. We filed a patent is granted. I went to the hearing myself, I talked to the patent controller. He was so much impressed. He said, I also am probably suffering from dementia. And I wish you all the best that you come out with a new anti-Alzheimer agent. And the patent was granted in no time. A novel paradigm for testing memory. This student gets a doctoral degree for this patent. And on the convocation day, she is congratulated. And now the chain starts. I tell my student, no publication, no poster presentation. You should have a patent. Then you have done real work. Newspapers तो अपनी सनसनाटी बना देते हैं. विसाख पर चूहे चल रहे चाल विसाख पर जीते तो दुनिया याद रखी. In photograph it comes. We should have an attitude of gratitude. My students are very grateful. See, in life you will meet 3 kinds of people, each one of you. I'm coming towards the end of the talk. So last few slides. You all will meet 3 kinds of people in life. Those who build you up, your teachers, your parents, your well-wishers, your friends. Some will have no influence on your life, and some will pull you down. You'll feel 3 kinds of people, all of you are facing. Some build you up, some have no influence, and some will pull you down. Be thankful to all of them. Be thankful. I'll tell you why. Those who build you up, they are making your career. You have to be grateful. Parents, teachers, they are working for your welfare. Those who have no influence, be grateful. There could be hurdles. They could create obstacles for you. They are not creating. They have no influence. So be grateful to them. And those who pull you down, they are the most important people in your life. They are making you strong. They are making you face the adversity. Be thankful to them. Whatever you are is because of really them who tried to pull you down and you did not give up. You continued. You had perseverance. You had determination. So be thankful. Be thankful to all these three kinds of people because tough times don't last. Tough times don't last, but tough people do. Those who create obstacles in life, they can say, I have created 1 lakh obstacles. That is their achievement. But tough people, they have overcome those obstacles and they have become great professionals. So be a great professional. No matter where life takes you, always pack a positive attitude is your back. Always be positive in whatever the circumstances. Even if it's very easy, to be happy and positive when everything is fine, going green, life is like a song. But what when we face adversity? What everything goes dead wrong? There, if you remain positive, you are a worthwhile, really brave person. That is where you should be positive. One thing with my experience, I tell you. शाहरुख खान की आवाज भी बता देंगे, उसका डायलॉग भी बता देंगे. उसके पहले, cosmos energies support your efforts and make impossible things possible. Just young students remember this in mind, and all senior members also will agree with me. Cosmos energies, they will conspire if you desire something strongly to be successful. Only thing you should be passionate about it. अब शाहरुख खान एक मूवी में क्या कहता है पता है? इसी बात को हिंदी में, अगर जिंदगी में किसी चीज को शिद्दत से चाहो, अगर जिंदगी में किसी चीज को शिद्दत से चाहो, पूरी कायनात कोशिश में लग जाती है कि आपको वो चीज मिल ही जाए. पूरी कायनात लग जाती है कि आपको वो चीज मिल ही जाए, और वो चीज मिल ही जाती है.
So thank you, Milind sir, for this speech. Actually, human beings coexisting of self and body. So we should self-domain, the consciousness domain, and he always emphasized to nurture our the self-domain. So it is the time for the question and answer. Delegates, if you have any question, you please ask, and Milind sir will answer this.
Hello, sir. Simple question. At this age also, how you are so energetic?
There are such energetic, youthful students around. They give inspiration. They tell me that I am like them and they are like me. In life, enthusiasm plays a big role. If you are enthusiastic, you are going to be successful. Be enthusiastic. Question, please. Thank you. Thank you, all of you.
Thank you so much, sir. We have a very small token of appreciation for Professor Milind Parle. I would like to call on stage our Dean of Academics, Dr. Jisuconph, to do the honors.
Before I move on, I must say, Parle sir
He's the only one delegate. As soon as we informed, he has procured his own train ticket from Delhi, and he has traveled all alone. We even do not know that what will be the ticket cost, and sir has got the return ticket well after the completion. That is, sir will be with us till 25th, I believe. So, sir, with your kind permission, if we get a chance to interact with our PG students, that will be great for us.
My pleasure. Thank you. I am here for next 2 days. I am with you. He offered me air ticket, I said no, don't spend on me. We'll spend it for some useful cause. So I don't mind traveling by train. And that's how, I come.
Thank you, sir. We would request Dr. Maji to kindly stay back to do the honors for the evaluators. We have our evaluator for the oral session, which is going on as a parallel session. I would like to call on stage Dr. Utpal Nonde, Associate Professor of Dose Institute, to kindly come up for the evaluation. This is a token of appreciation from our side. Sir has acted as an evaluator in the oral session. Thank you, sir. We will be taking 5 minutes of time. We'll be beginning the valedictory session shortly.
We are waiting for Mrs. to come. She will come. So please bear with us for a few minutes.
Thank you so much to all of the delegates, all of the dignitaries, and all of the participants who are present over here from different institutes of India, of West Bengal. And as we know that we are at the valedictory session. So we will be right now announcing the names of the participant who has scored highest in the poster presentation. So in the last 2 days, we had poster presentation in different categories, in the category of pharmacology, pharmaceutics, pharmaceutical chemistry, and miscellaneous. So for pharmaceutics, we had 4 sessions. For pharmacology, pharmacology, we had 4 sessions. For miscellaneous also, we had 4 sessions. For pharmaceutical chemistry, we had 2 sessions. From each session, we had selected the best poster. So for pharmaceutics, it will be 4 best poster. Pharmacology, it will be 4 best poster. Miscellaneous, it will be 4 best poster. And from pharmaceutical chemistry, as there was a 2 session, so there will be 2 best poster. And also we will give away the award to the poster from each of the session. It will be an appreciative award. So we would like to appreciate, you can say the second position of it, or you can say it's an appreciation from our side. So before we move on to that, I would request our Honorable Vice Chancellor, Professor Bhavesh Bhattacharya, our Honorable Dean Academics, Professor H.S. Maji, and Wong Sir, Professor Wong Ting Wee, to kindly come up and take a seat on the stage, sir. Thank you so much, sir, for taking your seats. So we will start with the pharmaceutics. So as what we are doing, the sequence which we are going to follow is, we are going to announce the name of best poster of each category and each session. And after that, we'll go to the appreciation award, I'm sorry. So from pharmaceutics, I'm starting. The best poster is, the name of the participant is Dipanjana Ash from BCDA College of Pharmacy. Please give a big round of applause. Dipanjana Ash. She is not here. So for the second slot, we had 2 best poster on the pharmaceutics. It is Oyon Dotto from BST. Oyon Dotto. Another is Sheikh Anwar Ali from IPT Salipur. Sheikh Anwar Ali. Next is Abdul Shamad from the Department of Pharmaceutical Technology, Tianas University. And I request Honorable Vice Chancellor, sir, that if you kindly give over the award to Abdul Shamad. Here we have on the pharmaceutical category best poster, Swarnim Gupta from JIS Pharmacy Kolkata. Swarnim is not here, so PQ sir will take the award from on behalf of Swarnim Gupta from JIS Pharmacy Kolkata.
My PhD scholar, I'm going to
Swarnim is a scholar of PQ sir, so he is taking on behalf of her. Thank you, sir. From the Division of Pharmacology, the best poster for the first session is Sweta Kundu from Rice University Bioscience. Sweta Kundu from Bioscience Department of Rice University. Thank you so much. The next best poster is Kalyar C. Kasiranjan from Madras University. Please give a big round of applause, everyone. From Madras University, Kalyar C. Kasiranjan. The best poster on the Department of Pharmacology. Next, we have Shayan Kumar Ghosh from Midnapur Medical College and Hospital. Shayan Kumar Ghosh from Midnapur College, Medical College and Hospital. And next, we have from the Department of Pharmacology, Sudipta Mongol from Jharkhand Rai University. Sudipta Mongol from Jharkhand Rai University. Sudipta Mongol from Jharkhand Rai University. Congratulations, Muslim. Thank you, Jisuconph, for the honor. Now we'll move on to the category of pharmaceutical chemistry. We had two sessions, so we have two best posters. For the first session, we have Mrinmoy Day from the Department of Bioscience, Rice University, and one for Defense University Award. Mrinmoy Day from the Department of Bioscience, JIS University. Mrinmoy Day. Next, we have Shuripa Chakraborty from North Bengal University. Shuripa Chakraborty from North Bengal University in the domain of pharmaceutical chemistry. Shuripa Chakraborty from MBU. Sir, if you kindly stay back a little bit. In the category of miscellaneous, we have Taureen Rahman from Bharat Technology. Taureen Rahman from Bharat Technology. Taureen Rahman. Okay. Next, we are moving Sriporna Pushti from Department of Pharmaceutical Technology, JIS University. Sriporna Pushti. Anyone on behalf of her would like to take the award? Next, we have Rajesh Kumar Mukherjee from JIS University. Rajesh Kumar Mukherjee. And next, we have Ashwati Sen from Department of Pharmaceutical Technology, JIS University. Ashwati Sen. Ashwati Sen from Department of Pharmaceutical Technology, JIS University, in the category of miscellaneous. On the behalf of Tori Brown. Thank you so much, Mom, sir, for doing the honor. Now we'll move with the appreciation award. We're starting with again pharmaceutics. So on pharmaceutics, we are having Asha Bori Nayak from Asha Bori Nayak. We have Asha Bori Nayak. Next, we have Seema Jana from North Bengal University. Seema Jana from North Bengal University. And request Martin sir to kindly give over the award. Seema Jana from North Bengal University. Next, we have Onolipi Vishal from North Bengal University. Onolipi Vishal from North Bengal University. Next, we have Payal Guru from Department of Technology, JIS University. Payal Guru from Department of Pharmaceutical Technology, JIS University.
Next, we have Moumita Shi from IIT Kharagpur. Moumita from IIT Kharagpur. Moumita Shi from IIT Kharagpur. In the Department of Pharmacology, we have Shomodi Paul from Ashutosh College. Shomodi Paul from Ashutosh College. We have it. Next, we are moving to Shomen Thara from NSHF College Campus. NSHF College Campus, Kolkata. Shomen Thara in the Department of Pharmacology. Next, we have Lamia Yasmin from JIS University, Department of Pharmacy. Lamia Yasmin. Lamia Yasmin from Department of Pharmacy, JIS University. Next, we have Hira Bhowmik from Department of Pharmacy, JIS University. Hira Bhowmik. Hira Bhowmik. Next, we have Debarko Performa. Debarko. We have Debarko. Okay, so Peter sir is again taking on the behalf of Debarko.
Margo and Hirok both of my scholar.
Thank you, Maji sir, for doing the honor. Next, we have in the category of pharmacology, Obinava Gupta from VIT Mesra. Thank you.
Menu কিন্তু বেড়ে গেল এই মেনু বেড়ে গেল আইটেম বেড়ে গেল
So we are moving to the next category. Riton Dotto from Department of Pharmacy, JIS University. I request VC sir to kindly give away the award. I request VC sir to kindly give away the award to Riton. Riton Dotto in the Department of Pharmaceutical Chemistry. Next, we have Mrs. Onuha Shamanto from Department of Pharmacy, JIS University. Mrs. Onuha Shamanto from Department of Pharmacy, JIS University. In the Department of Pharmaceutical Chemistry. Please give a big round of applause, everyone. Next, we have Vikram Nondi from Bharat Technology. Vikram Nondi from Bharat Technology in the category of pharmaceutical chemistry. Vikram Nondi from Bharat Technology. Next, in the category of miscellaneous, we have Ognik Mukherjee. We have Ognik Mukherjee from JIS University. Ognik Mukherjee. Ognik Mukherjee from JIS University. Ognik Mukherjee, sorry for the mispronunciation. Next, we have Shreya Ghosh from Guru Nanak Institute of Pharmaceutical Science and Technology. Shreya Ghosh from GNI PhD, Guru Nanak Institute of Pharmaceutical Science and Technology. Shreya Ghosh from GNI PhD. Thank you, VC sir, for doing the honor. I request Bob sir, if you kindly give over the award of the next category. In the miscellaneous, we have Onnesha Shortcut from Global College, Onnesha Shortcut from Global College. We have Shrestha Prasad from Department of Pharmacy, JISU. Shrestha Prasad from Department of Pharmacy, JISU University. Radhasham Sheth from North Bengal University. North Bengal University, Radhasham Sheth. Next, we have Tonika Sarkar from Department of Pharmacy, JIS University. Tonika Sarkar from Department of Pharmacy, JIS University. In the category of miscellaneous poster presentation. Congratulations, Tonika. Okay, we left with one Obinova Gupta in the category of pharmacology from PIT Mesra. Request Obinova to kindly come up and take the certificate. Obinova Gupta from Indian Institute of Technology, Mesra. Obinova Gupta from PIT Mesra. Give a big round of applause everyone from that. Thank you, Wong sir, for doing the honor. Thanks so much. Okay. Now we are moving to the, as we know that today we had our oral presentation. So on the oral presentation, we are going to give away the award on the two category, first and second. So we are moving with the second. So on the second position, we have two participants. On the first position also, we have two participants. On the second position, we are having Anjun Mondol from IQ City, Durgapur. Anjun Mondol from IQ City, Durgapur. Please give a big round of applause for Anjun. I request Master Sir to kindly give away the award. Anjun Mondol from IQ City, Durgapur. Anjun Mondol from IQ City, Durgapur. On the second position, we have another one. Nibir Ghosh from Eminent College of Pharmacy. Nibir Ghosh from Eminent College of Pharmacy. Nibir Ghosh from Eminent College of Pharmacy. On the first position, we have Rajarshi Nath from JIS University. He's a PhD scholar at JIS University, Rajarshi Nath. In the first position, we have Rajarshi Nath. Congratulations, Rajarshi. Next, we have Satyajit Mohanty from PIT Mesra. Satyajit Mohanty from PIT Mesra. We have Satyajit Mohanty from PIT Mesra. Thank you, Maji sir. So thank you so much to all of the participants. As we are almost at the end and on the third day of our conference, I would request our Honorable Vice Chancellor, sir, if you kindly address on the last day of our conference, sir.
Very good afternoon to you all. So we are at the culmination of the third day international conference. At the outset, let me express my gratitude to my faculty colleagues for an extended toil and hardship they have confronted while organizing this conference. I've seen them working beyond much extended hours to make this conference successful. Lot of hard work has gone behind this. I hope this spirit and the involvement would be carried forward by the university to make a few such programs in days to come. My appreciation to all the participants who have got awards and who have participated even. I saw a large number on the inaugural day. Today also I am finding a large number participated. Most satisfying is it has come from diverse institutes. We could accommodate people from pan-India. This is one success story of this conference. And I hope the achievements, the gain with respect to knowledge and experience would be taken forward to your own institutes, and the subject of this conference would find better exposure in days to come. I thank all the invited guests who have come from abroad and also from different parts of the country and graced our this university. Their participation was very important for us. I finally congratulate the core organizing team for their success. Thank you all.
Thank you so much, sir, for appreciating our hard work we put together to make this conference possible. I request Professor Wong Tung Wee, sir, if you kindly give your address on the last day of our conference.
In Guatemala, I think first of all, I wish to express my heartfelt gratitude to the Honorable VC, Prof. Imanshu, Prof. Tapan, and Prof. Pintu, and all the organizing committee to provide us the opportunities to be here and to share with you our research and education findings. So I think the event is successful, and we have very good speakers from local and overseas. I think the excellent one should be the students, and especially students who on one hand needs to present a poster, on the other hand needs to sort of organize and coordinate events, right? I shall not say the good things, perhaps let me share with you what are the bad, right? I think overall, with respect to the students' presentation, and yes, they have the opportunity to look at the poster. I think poster consists of two categories, review and research in natures. The data is extensive and impressive. So if you ask me, I think the students in GIS and also other parts of the India's, they know what to do with the research. They also know how to do with the research. The only problem is that I think they didn't evaluate the prior arts. They didn't evaluate their competitors' findings. Hence, they fail to justify how important is their results, or how significant, or how different, or how novel it compares to the competitors' findings. So I guess in long run, students, they need to spend more time to look through the literatures, especially the recent 5 years literatures, and to see any gaps, big gaps that you can fill in. So instead of perhaps receiving instruction from your supervisor, right? I think the last plenary speaker highlighted in India, the teacher will say do, and the students say yes. So perhaps this also happens in today's students. Hence, you present very well, but you didn't know why you need to select this plant, right? You only know that your boss, your supervisor asked you to. Yeah? And pertaining to the event, delivered with various lectures delivered by local and international speakers, I think the contents are perfect, integrated. So it definitely will be useful for the pharmacy professions. The only thing is hopefully we can also increase the female speakers, right, in the conference. So that will be ideal. And apart from that, I guess now traveling is expensive. Thailand, Malaysia to India is relatively less costly. But in order to involve a speaker from, let's say, America, Australia, New Zealand, Europe, and UK, I would suggest in the next event we have a hybrid. So we can have online by the international speakers who stay far away from India. At the same time, some of us who are nearby could be here together. With that, I wish to thank the organizing committee again, and also all the best to the JIS University. Thank you.
Thank you so much, sir. We would now move forward for the appreciation of our oral evaluators who have been evaluated right from the morning. I would like to call Dr. H.S. Madhi, Dean Academics, to kindly do the honors. I would like to call Dr. Debanjan Sen, evaluator of oral presentation from BCDA. Dr. Debanjan Sen from BCDA College of Pharmacy. Thank you, sir. Next, I would like to call Dr. Shubham Lal Gayan from Jadavpur University. He was an oral evaluator today. Thank you so much, sir, for giving us your time. Thank you, sir. I would like to call Dr. H.S. Madhi, Dean Academics, for his closing speech.
Honorable Vice Chancellor, Professor One on the dais, the dignitaries of the dais, the delegates who have participated in this 3 days program, and my dear JISU-PHARMA family, who has worked for the last 20 or 30 days, day and night, to make our effort a successful one. See, as one sir was telling, everything goes well, that ends well. At the end, we received Parle sir, who is the name itself, and our closing speech was more than. It is actually the 100% of the utility of our conference. The treasure was kept behind the scene. He was throughout the program, and at the end, as expected, Sir has met this day for all of us, for JIS University, for the Department of Pharmacy, and for all the delegates. So people like Parle sir, in the northern part of the country, I know, as Sir was telling, we had got long-standing relationship only on WhatsApp and chat only. But in northern part of the country, Milind Parle is a name in the profession of pharmacy. I know for the last 20 or 25 years or so. So we are grateful, sir. We are grateful that you accepted our invitation and made this day successful. I must extend my thanks to one worker, sir. Though we were not intimated or closely earlier, but I came to know your name from Inderbir Singh sir of Chitkara University. And then I thought that we should take this opportunity to have an interaction. I was present in your deliberation, and we are honored to have you. Sitesh Bachar sir is a close alliance to all of us in the eastern part of the country, has made us proud by his kind presence and deliberations. We had a number of times interactions regarding the conferences. Thank you very much, sir. And lastly, Anna Thapa sir is here. I have got one scholar, Mr. Deepo Das, through which the last month he met with sir, and we are in a memorandum of understanding with Kathmandu University for the last 1 year or so. In fact, in our last convocation, the Vice Chancellor of Kathmandu University came, and then we thought that why not we should take the opportunity to collaborate with the Department of Pharmacy. Thank you, Parnavadu Thapa sir, for your presence. My thanks goes to all the speakers, all the participants, all the winners, award winners. This was our small ND award. Actually, the work started last year. For the 1 year or so, we tried to think, we tried to formulate, we tried to look for funds, and this is what ends. Everything is well that ends well. Parle sir made our day. I am thankful to all the delegates who have shown your trust on us and make this 3-day program a successful one. We are receiving comments from the speakers. The moment President of Pharmacy Council of India agreed, he agreed almost at the 11th hour. Then he thought that, another kind of mileage we might have received. But believe me, by that time, almost 80% of the registration were done. So, as I was saying in the opening day also, that we are on the 8th year of running of this department. And it is all possible because of the joint and untiring effort of the faculty members of the Department of Pharmaceutical Technology. I believe that with your blessings and support, we will continue to put mark in the domain of science and technology, and we will continue to have your support in our journey towards excellence. Thank you.
Before we move to the last segment of our international conference, I would request Professor Maji to kindly give a token of appreciation to our evaluator for oral presentation. I would like to call on stage Dr. Nilanjan Ghosh from Jadavpur University to kindly come up and take the token of appreciation from Dr. Maji. Thank you, sir, for your time. Thank you, sir.
Before we extend a vote of thanks with the permission of Honorable Vice Chancellor, may we have feedback from the participants? We'll start with anyone. Or sir, can we have participants from the speakers, remaining speakers also? Components, sir, if you please come, say a few words. Hello.
So, first of all, I would like to thank this committee and the for inviting me. This is my second time in India, and I can feel something that everyone really, welcome me from the airport. He's very nice to take me from the airport, and every step in the conference, everyone would like to know me, would like to talk with me, especially would like to take a photo with me. So I can feel the energy of you that you would like to explore the world to conduct the research. And I think this is very good for a student to, experience international things like this. And it would be great if we have something like joint conference, maybe not have to, face to face, but like Professor Wong says, we might have like a conference between Thailand, Malaysia, and another country that be in the similar zone time. And like poster presentation online or something like that would be very good. And in the future, exchange student or exchange program, it would be very, very beneficial. So again, thank you, JS University, and everyone here. And maybe the problem, few words for us. Thank you very much, sir. India is like a home to us for Nepalese people because we are very close in many terms. People to people, government has a different story, but people to people culturally are very close. We respect each other. As for the conference, as Professor Wong, Dr. Kambhat saying, it was not saying it was very good. I think in future, building up on the resources, we need to have a hybrid mode of thing for especially for far away the speakers that will have a mode. Although it's very difficult to manage. We have been doing the oral presentation, and one of our students also did it. So in past 2 or 3 days, we spoke about science. I think most of this new generation or young researchers, students, I think they must have been motivated by our eminent speakers from home and then from outside like us. The main purpose of the conference is just to share and then grab some ideas, as Professor Parley was saying, we have to do it. And moreover, the Kathmandu University and the JIS University, we do have recently we have signed memorandum of understanding. Our Vice Chancellor was here a month ago or 2 months ago during the convocation. So we'll talk in detail in days to come. We'll have and wish you all the best. Thank you. Thank you, sir. Yeah. First of all, I would like to extend my gratitude to the organizers, especially Dr. Imanshu, Dr. Tapon, and my
especially Tipo. It's very nice to be here today because, I have so many problems in Bangladesh at this moment. Before, to come here in India, mostly Jadavpur is my alma mater. I used to come every year, twice or thrice a year. And usually in the 1 month or 15 days notice, I always try to attend so many seminars and symposiums in India. But nowadays it's very difficult to know the reasons. But even because Dr. Wang is very much known to me, Jadavpur, Professor T.K. Pal, from where Tipo and others is very much acquainted with this matter. And Panna is my alumni of Dhaka University. He's only 2 years junior to me in the university of that days. So that is a good connections with him. Also last year, I also visited Nepal in another symposium. I just newly have been aware about Dr. Kampan. I think we should have to do collaborations next time. We have some friends in Thailand also. And I'm happy to be introduced myself with Dr. Milin. His nice presentations. How can a research findings can be disseminated, including the minds of the students that we have learned from him. So I'm very, very proud to having these other faculty members of this Department of Pharmaceutical Technology, this university, and especially the beloved students, the enthusiasm from the beginning to till today. Most of the things at the end of this symposium, participants is most of the cases going out. But this room, this conference room says that the enthusiasm and the interest about the conference is so much that is very appreciated from all of us. I think very much next time, as Dr. Wan suggested, if we are not able to come here, hybrid mode. Thank you very much.
Thank you.
You have been listening to you. Last 3 days, I am with you. And when anybody asks me about my profile, from where do I come from, it becomes a tough question for me. Because I was born and brought up in Maharashtra state. I had my schooling in Pune. And I had my higher studies, M.Pharm, doctoral studies at Punjab University, Chandigarh. Chandigarh is a union territory. Then I was in Delhi as a deputy director of AICT. Then I moved to Haryana, the new Guru Jambeshwar University of Science and Technology, which is an international university today. And being a chess player, I have been traveling around the world. So I have many homes. But the good news for you all, Honorable Vice Chancellor, Himanshu, faculty members here, now I can say I have a home in Kolkata too. I was so well received. My train was to reach at odd time, 4 a.m. in the morning. And the volunteer was keeping the track under the guidance of a faculty member on the running status, and they left no stone unturned. The moment I came out, half sleep, you can imagine 5 a.m. the time, and there was some volunteer to pick up my bag and take me to hotel. I was overwhelmed. And even today, all 3 days, I felt as if it's not the JIS, but it's me who is hosting the conference. So much of affection, so much affection. In every session, I was given an opportunity to interact. So I have no words, cultural programs, wonderful efforts by BPharm and MPharm students. Hats off to you all. And then thinking out of the box, blending cultural program with scientific programs, again a great thing. Food has been excellent. From one venue of seminar hall to another, I know the kind of efforts involved, the kind of anchoring involved, the kind of mementos and certificates Abstract book is online, souvenir is in my hand. What more, when one's in the conference? Wonderful, well done, well done. Thank you.
I request one or two participants to share one or two words. From Madras University is Palayarasi Kasiranjan, if you are there. Yeah, on the very beginning day at 8 a.m. in the campus, when I reached, I saw her. She didn't have an hotel arrangement at all. She was alone, traveled alone from Chennai maybe. Please share your experience.
First of all, thank you, sir, for giving these opportunities. And I came alone, you say, this is my second conference. Already I hello.
Yeah.
I came, and this opportunity is I got some scientific lecture from the international speaker. This is useful for my future, sir. Thank you, thank you.
Thank you, thank you. You have Momita C in the house. Momita C. Do you have? Yeah, please share your experience.
It's a great conference. The scientists, speakers, it was useful for our research work. And everyone is very cooperative. Thank you.
So Mongol is here from Jharkhand Rai University.
It's a wonderful experience for me. It's a proud moment. I'm in first batch of B.Pharm, and presently I am assistant professor at Jharkhand Rai University. So we are a team of 27. So I came along with my students. So this is their first ever international conference they have ever attended. So it's a great opportunity for them also to explore various review papers and various scientific poster presentation as well as oral presentations, and to engage with the international speakers also. So it's a great platform which was provided by the JIS University. So thank you very much to the organizing committee. And we have done MOU with JIS University. So we are expecting a collaborative research work so that students can got benefited with these advanced laboratories which was provided by the JIS University along with our university. Thank you very much.
Thank you. Thank you. We have Mr. Tobirul Islam in the house. Yeah, please, one or two words.
Says from the beginning, your hospitality, your theater and working team, you want just a team, a family. This is an international conference, it's a great conference. Today, I also get the oral presentation, but always there is a poster presentation, oral presentation, conference, and other cultural program, all is in my heart. And I will like that. Congratulations for the JIS family and thank you.
Thank you. Thank you. Before I close, I read out one comment I have received from one of the speakers, though it was addressed to me. Well, replace. Dear JISU-PHARMA family, congratulations on the successful closing of the conference. Every aspect, from the carefully curated speaker lineup to the seamless logistics and impeccable venue setup, reflected a masterful planning process. Your tireless efforts behind the scenes ensured a truly exceptional event that exceeded expectations and left a lasting impression on all who attended. Best wishes, Dr. Inder Veer Singh Chittapalli. So these are our gain out of the conference, and we need your blessings. Thanks to JIS Group. I'll hand over the mic for a vote of thanks.
Thank you to all the participants, the speakers, and Dr. Majid. I would now like to hand over the mic to Professor Kamalakant sir for the vote of thanks.
Good afternoon. Respected Chancellor, respected Chancellor, respected Vice Chancellor, Director, Dean of Academics, dignitaries, keynote speakers, honorable guests, delegates, participants, and organizers. I would like to extend our heartfelt gratitude to each and every one of you for making this 3-day international conference a resounding success. We are deeply grateful to our keynote speakers for sharing their invaluable insights and expertise, enriching our knowledge and perspectives. Our sincere appreciation goes to our delegates and participants for their active engagement, thought-provoking discussion, and contribution to the conference proceedings. We also acknowledge the tireless efforts of our organizing committee, volunteers, and support staff who work diligently behind the scenes to ensure the smooth execution of this event. Thanks to our sponsors and partners for their generous support, enabling us to host this conference. Last but not least, we thank our higher authority for their invaluable contributions. As we bid farewell, we take with us memories, knowledge, and inspiration. Thank you once again for your presence, participation, and support. We look forward to welcoming you to our future endeavors. Thank you all.
Sir, a very important announcement for the participants. The participating certificates will be given out from this auditorium from 3 p.m. onwards. So kindly come to this auditorium for your participating certificates at 3 p.m. Thank you. We will now wait for our delegates and for our speakers to leave first, and then the participants will.
Please take your seat.
We will stand for the national anthem. Thank you all. Participants are requested to leave from the back gate. Participants, please proceed to leave from the back gate. The lunch will be provided from the canteen. Please kindly let the participants go to the lunch. Participants, please. participants, please settle down. Now, please settle down. Ready for lunch, so please sit down. Sit down. Please sit down.
Our volunteer will guide you. Please settle down because you are moving around. You don't know that. It is guaranteed. So our volunteer will guide you.
Kindly settle down at the back. Will be guided to the venue.
আমি বললাম ছেলেকে ও আমি অনেকক্ষণ থেকে আপনাকে দেখছি আমি তাই বলি আমি কোথাও দেখেছি আপনাকে
তুই দেখেছিস কাউকে লিখে চলে যাচ্ছে
চলো এই শোন এটা মিটিং অফ করে দিবি হ্যাঁ আমার পরে লাগবে না